I'm just sharing up the live here. And see who's gonna be showing up. Showing up, showing up, showing up. All right. Colette, welcome. How are you doing? Make sure I know I'm loud, but I'll make sure you hear me well. Okie dokie. I need a different track for this thing. How are you guys doing? Who is here? Oh, just one person. How are you doing? Seda Thompson, how are you? Welcome. What are you up to? How is your morning going or your afternoon? What time is it? 11. So morning, afternoon, evening. How is it going? Francis Smith. Hi everyone on YT and on TT. Welcome, welcome, welcome. How are you doing? It's almost lunchtime for me. Not fully lunchtime, but you know, almost. It's almost 12 o'clock. How is it going for you though? All right, so let me go ahead and just, which phone that's? I'm gonna go ahead and hi Jen, how are you doing? Incredible. Tony, hi Tony, CO Zoe, welcome, welcome. How are you guys doing? Glass is foggy. Scorpio, welcome. Remember to go ahead and tap up the live. All right. You can also share, remember your daily heart meals as well. That would be nice. And give the video a thumbs up. Who is on over by YT here? Can you say hello? If you don't mind. All right. Yeah, so I see him coming on. I have my notes to do. I know probably it's not the best time to come on the live. Sometimes the notes them boring. So I need a little bit of a company while I'm charting sometimes. Not really company, but at least, you know, it will keep me up. Having you guys will keep me up on the live. As well as with charting. So yeah. Alright, and the glass is still not clean properly. Anyways. Yeah, so how is your morning going? Watchman on the walls, welcome, welcome. Live shines, welcome. How are you doing? Remember to tap up the live and do your daily heart meals. All right, remember to do your daily heart meals. It benefits you as well, especially if you're doing content. If you're posting content, it's gonna help you. All right, so always remember your daily heart meals and your comment and what else? Your likes, your share and follow. Yeah. All right, so how is your day going? Is it lunchtime for anybody yet? What are you having for lunch? I had a smoothie this morning, so I'm not having anything heavy. I'm trying to change my diet. All right, so I'm not having anything heavy today. Probably this evening probably this evening. I'll try to work out before I go ahead and eat anything heavy though. But I had my little smoothie. I did made, it's the same regular smoothie. One little banana. Oh, let me pull this down. One banana. Oh, you can't move? I guess you can go up here. Okay. One banana. What else I had? Some peanut butter in it, milk, and I added some water because I never wanted it to be like, you know, totally milky. You know, so I add some water to it, some milk, and peanut butter, cinnamon, and oats. Yeah, oatmeal. And that was it. Blend it up. Belly full. Alright, so hi Chad, how are you doing? Chad 11, welcome. So that's what I had this morning, and it has been good. My tummy still feels full, so just gonna drink my water, no flavor. Alright, no flavor, just my regular water, and that's it. Okay, nice. Yeah, I'm doing fine. So I'm actually off today. Was kind of catching up on a few things and trying to make one and two little TikTok videos. Oh my word. Yeah, I was trying to make some TikTok videos earlier. And then I said, all right, I'm going to come online and, you know, just try to catch up a little bit. At the same time while I am trying to complete my notes. Not good, not true. Yeah, I know it's not good. Yeah, so that's it. But you know, I'm here. You can always ask any question that you have related to nursing, travel, and lifestyle. If you're new here, I'm Stacy, originally from Jamaica. I'm a nurse that was trained in Jamaica, worked in Jamaica for 4 years, then migrated to the States in 2016 using a recruiting company. And if you want to know more about that, you can always ask the question. All right, you can always ask me questions regarding that. I'm very transparent with the process and how it has been. All right, so you can always ask me any question. And I've been working in the States since 2016 when I got here. Went back to school, did my master's, working as a hospital nurse practitioner now, and it has been good. All right, it has its up and down, you know, in terms of the days, where some days it's awful, but otherwise it's good. All right, it's good. I love the flexibility that I have with it. And so I'm trying to build my content, you know, my pages. So go ahead and, you know, follow me. You can also subscribe to my YT page at ThinkNursing. Thank you for the heart, me at ThinkNursing. I share a lot of content related to nursing, travel, and lifestyle, as the name suggests, ThinkNursing. All right, you might have 1 and 2 random videos over there because you don't want my page to be boring. I don't want my page to be boring and then you guys don't watch the videos and all of those things. So you'll find 1 and 2 additional videos on those, you know, on my YT page. But all my live streams are posted over there. In terms of my nursing live streams, they're all there. So if you're wanting to study for your NCLEX, the RENR exam, which is in the Caribbean, you know, the Caribbean exam that we do for license, then it's something that will benefit you as well. All right, if you are a nurse, I think it will also help you. It's more of a refresher course, so you can always tune in at 7 p.m. on Tuesdays and on Thursdays. And I still do my pop-up live, as you can see, throughout the day. All right, throughout the day, I'll do my pop-up live. I also do exercise in the evenings on Monday, Wednesdays, and Fridays. So you can always tune in. All right, tune in for those classes as well. Well, it's not really me teaching no class, you know, but if you want somebody to exercise with, you can always, you know, come over and hang out with me. I do need the support. All right. I'm sure know that if you're exercising as well, probably you need a little bit of a support. So feel free to come on and you know, just join me while I exercise. All right, and that's what I do on those days. But otherwise, it's pretty decent. All right, at least that's how I feel. It's pretty okay. All right, so as I say, today I'm just charting. If you have any questions, you can always ask me. I'll be here. You can ask me any question regarding nursing, travel, lifestyle, things like that, and I'll answer it. And if you have something specific that you want to talk about that you don't want anybody to know about, because you know sometimes we're very secretive, feel free to go ahead and inbox me. All right, you can DM me on TikTok and I will answer your question or your concern. All right, if you have a topic that you want me to talk about, it's the same thing. leave it in the comment, and you can also DM me and I will respond to them. All right. Yeah, so that's what we'll be doing today. Oh, somebody was supposed to kind of help me with TikTok too, you know, because I've been doing all of these TikTok videos, these live stream, and apparently there are some things that you need to claim. Yeah, I wasn't claiming them, so I need to do that. So when I start doing my videos a little bit more frequent in terms of my live stream, they can go out to the different, you know, folks out there. So I need to get on top of things with my TikTok and claiming my points that I've earned on different live streams. So yeah. All right. Thank you for joining in, Leroy War Dog. How are you guys doing? All right. I really don't want to play any music because, you know, after on TikTok here, seem like all the music that you put on your videos are getting muted. Yeah, TikTok kind of acting weird, so that's just it. Thank you for the follow. Who was that? Jude's, I think it's Jude's Bello. Welcome. Thank you for the follow. All right, Lila Mama, welcome, and thank you for following as well, Chad. All right, where in Jamaica are you from, Chad, if you're still here? Where in Jamaica you come from? Hey, Val, how are you? I said last night I was doing the live, and I'm telling you, girl, last night I was a little bit tired because I had so much things I needed to get done. Yes, I say I couldn't do the 4 hours. You know, usually on the Thursdays, we tend to go a little bit longer with our live stream. So last night we did musculoskeletal. And I think probably because, you know, musculoskeletal and neuro. But then neuro was even better than musculoskeletal because a lot of my folks who show up, them start sleep, I guess. Them never like musculoskeletal system. I want to sleep later. Okay, watchman. So they wanted to sleep last night. So it was I'm not gonna lie, it was a little bit boring last night. So even if I wanted to push it, it was a bit difficult to push it because I wasn't getting the vibes. The answers weren't popping up as how they were, you know, on other nights. But it was good either way. We did almost, I think it was almost 2 hours we did. We're going to say 1.5 hours we did for musculoskeletal. And I think we covered a lot of information. We're not live, but may I tell you, musculoskeletal was boring. Neuro was boring. But even though it was boring, like persons were answering questions. But neuro was never my thing in nursing school. It was never my thing in nursing school. And I think it's the same thing with a lot of persons. Like, you know, neuro is a problem. It's a challenge. All right. But I'm trying to go through each system with getting some questions, try to just answer them based on like safety, you know, the different multiple choice, med surg questions, pediatric questions based on different system, and try to just study broad. All right. Rather than just focusing on like, you know, one spec question, multiple choice, and that's it. We try to cover different questions that is related to like safety, you know, comfort, prioritization, select all that apply. That's how we try to study when we're doing the questions in the nighttime. And it has been good. Abby, how are you doing? It has been good. But may I tell you, musculoskeletal last night. Carousel, I don't think Carousel is here as yet, but Carousel sleep all the whole of the night. You understand? But Carousel was on top of things as usual with answering the question. We don't even know if Carousel is a male or a female. I need to ask. But Carousel was always on top of things with answering questions. Melva Watson Blake, welcome. Life Shines, how are you doing? Thank you for, is she here or probably just doing another live? Yeah, but it was good otherwise. It was good. So I don't remember which one I'm going to be doing on Monday, but we'll try to see if we can get it a little bit more interactive. I want to catch it one night, but I did enjoy it and I did learn a lot that night. Oh, Melva, thank you. Thank you. Yes. Yeah, that's been pretty good. I like the study sessions. I'm not lying. I've been learning as well because a lot of the content that we've been covering, you know, you probably have an idea of them, but because it's not something that you see that commonly in the field, then you realize that, you know, some of the information are retained. In a retain, you still probably remember one and two things, but you know, with this course, or not the course, because it feels like a course, with this you know, the study session that we've been having, I'm telling you, it has been very, very informative for me. And I'm not saying it because I'm the one that has been doing it, but when I see persons putting in the answer, and if I ask them why did they say that, you see different answers, you know, popping up, and it's just a little bit more interactive, hearing how persons are thinking. No, you're fine, you're fine. Just make sure you subscribe to my YT page. All right, subscribe to my YT page. The full live is streamed over there as well, so just in case you miss it, you know, the live stream itself, you can always go back and get it over there. So it's ThinkNursing, one word. You know, I know probably you'd want the interaction like this, but it still counts. All right, it still counts. It has questions that you can definitely, you know, listen to and answer and hear the rationale. So that's it. All right, who this, you know, I don't know this name. All right, you can go to voicemail. Yeah. All right, so that's just it. But otherwise, I think it was good. It was good otherwise. As I say, the slot is for 1 hour, but we end up always doing probably like say 4 hours, 3 hours worth of study. But last night we did 1.5 hours, because before the live started, I was actually doing some things with getting a little bit more familiar with, you know, TikTok. And so we started, and then I think it was a total of 2 hours, but it was roughly like 1.5 hours we did for the live. But as I say, it was good. So if you have your friends, or if you have nurses who, you know, are studying for the NCLEX in our exam, then definitely let them know. You understand? And it's not even for only nurses, because you have some persons who just need to be in the know. You're a patient, you have no interest in, you know, the nursing field, but you want to have an idea of when you go to the hospital, what to expect on certain things. Because what I'm trying to do is I want to talk about the different management, you know, pick your brain a bit about the different management of different things, like your myocardial infarction, hypertension, how you go about with treating, you know, like your emergencies, non-emergencies, things like those. So it's not only for, you know, nurses, it will benefit other persons. All right, so at least you have an idea. Not saying you're gonna go to the hospital now and dictate how you want to be managed, but at least, at least you'll have an idea of what to expect. All right, and that's just it. But yeah, so it wasn't bad. So as I say, you can feel free to ask any question as you're here. Say, I don't really understand how people have long fingernails, you know. Me cannot understand it, because these nails are not that long, and anytime I'm supposed to be pulling up, like, you know, buttoning up and all them stuff there, is a struggle. It's a struggle. So I don't really understand how some people have some nails that are just so long. You understand? I'm not really used to them being this long. They're usually a little bit shorter, but I don't know. Those people that have longer nails, you know, them special. They're special. So that's just it. All right, so yeah. Alrighty, so let's just yeah, so you guys can ask me any questions, and then from there. All right, in the meantime, I want to play some music, but you know, on YT it's a bit of a problem. You understand? So I really don't want to play any music, but I'll play some music on YT, on TT here. And then from there, because me don't want to say that our life boring. Yeah, understand? They're gonna say, oh, you can't play some music. Play some music. Huh? That's what they're gonna say, you know. Alright, so what I'm gonna do, I'm gonna play some music in the meantime, and then at least if you have any questions, you can feel free to go ahead and ask in the meantime. Alright. And then later on I can do a question and answer session. How does that sound? How does that sound? Yeah, that's what I'm gonna be doing. Alright. Hey Marcus, how are you doing? How are you doing? How is your day so far? So I have this. Okay, nice, nice. Okay. So I have this patient. I'm trying to complete these notes. So this patient I have, she was admitted in ICU. I'm doing good, you know. Me good, good, good. I'm off, so that's good. No stress, you know, there. So I'm off, and it has been a good day. We're not lying. Oh, you're at work right now? Okay, no problem. Thank you for tuning in. Oh, thank you for the heart me as well. Yeah, okay. So that's fine. You know, just make sure them not see you there on I don't know, TikTok. You know, TikTok and all them stuff there. Yeah. Thank you for the roses. Thank you for the roses, Jennifer Morrison, to join as live guest. Oh, I think I probably need to start doing this now because I keep on seeing all of these little. Sometimes I send some requests. So I guess probably like whenever I am not. Let me see. How do I do that now? And see if anybody. Let me see if I can find somebody that I can send a request to for there was a young lady the other day. Alright, that not gonna work out. Alright, let me do one with the other. See more. Wealth and health, wellness, what? On screen. Alright, let me just put on my music. I don't know you. Oh. Yeah, let me put on the music, and then from there, if I'll come back on later. Hi, Leslie. And then I'll chart in the meantime. And then if anybody have any questions, they can always ask me and I'll answer. I'll pause and answer. So there is a wound care part-time job. Wound care pay good, you know, for nurse practitioners. Yeah. But me can't do it. Me can't do it, bro. Cannot do wound care as a nurse practitioner. Not even as a nurse. You understand? Cannot do it. It's just too much. It's just too much. All right, let me go ahead and play Emily. Hi, how are you doing? Unbroken, how are you? You know, I'm always happy to see you. Eh? You know, I'm always happy to see you show up on my page. How is your day going? Kev O'Neill, welcome. Thank you for liking up the live. All right, you can also go ahead and share the live as well if you can. Just share it with one person or two person. All right, share it to two person. That's all. I'm not asking nothing much. Just two person you'll share it to. All right, the first person in your list of contacts, you can go ahead and share it to. All right, I'd appreciate that. Princess Howie. Okay, so I'm good and I'm blessed by the Most High. Exactly. That's the most important thing. You understand? Because you have a lot of persons who never wake up this morning, you know. I have a friend that I met on TikTok. And I have a friend that I met on TikTok. And she had a family member that, you know, recently passed. And she's not having she's not taking it so well, which is expected. So, you know, when we wake up in the morning, we need to give God thanks for that, because a lot of person, them never get a chance to wake up this morning. Relatives never get a chance to say, you know, them last goodbye or them last, I love you, things like that. So most important thing, you know, you wake up, just to thank the Lord, and the Lord will continue to bless you, you know, give you more life. Yeah, so that's just it. So I know sometimes we might be going through some little, you know, difficult times, and we feel as though we're at the end of the road. You have some people who are out there struggling real bad. You understand? Struggling real bad. So we must just continue to give God thanks for the situations that we're in sometimes, because those are the situations that are, you know, building us, making us stronger. All right, and that's just it. Yeah, thank you, Kev, for the gift. All right, thank you. Beverly Palmer, welcome. So I have this patient, she's still screaming at me regarding pain medication. So she was admitted the other day for, she has respiratory failure. So she was admitted to the hospital, intubated. And she's on a bunch of medications, but she's on like 3 narcotics already. I'm tell her, say, no, I'm not ordering anymore. But she just feel as though she need more pain medication. So she's upset. So, but sometimes, you know, it is what it is. They're gonna get upset, but yeah, I'm not putting my license in that mix up. So I'm sorry. She went to pain management, and because she wanted pain management, so I sent her over to pain management, because initially she was with hospice that was dealing with her, but then hospice wasn't taking care of her diabetes and her blood pressure medications or hypertension. So I was seeing her for that, but then she has a lot of pain. So I said, okay then. I said, but you're already on fentanyl. And she was on Norco before. So I say, you know what? Hospice will deal with your pain, because they're the ones that are ordering the fentanyl. And so she went into the hospital, and she broke her leg in the hospital. She broke her ankle in the hospital. She was being discharged. They never discharged her with any additional pain medication, because, as I say, she's with hospice and she's already on fentanyl. So as soon as she leave out of hospital, the next day she go back to hospital. She go to a different hospital. You understand? She don't go to the regular hospital, you know. She go to a different hospital. And that hospital now went and ordered her morphine to go. So when she called, when the office says that, you know, she is actually discharged, I said, oh, let me just go and see her, because it was passing by. So she said she wanted pain medication. So I said, oh, okay, no problem. Go through her her list of medications, and realize that she's on fentanyl, she's on Norco, and she has morphine. So I say, are you taking all these 3 medications? She says, yes. I said, let me hear where you're taking it. When she put on the patch, and she also take the Norco in the morning, and sometimes she's still having the pain, she go ahead and take the morphine. So I say, you remember that you have a respiratory problem? You're just coming out of hospital with, you know, after being intubated for respiratory failure. You can't be on so much narcotics at once. That's gonna cause you additional problems with your breathing. So she's like, well, none of them not helping. So I say, I am so sorry, that's the situation right now, but one of the 3 medications should be working. I don't know why you're having so much pain, you know, even though pain is subjective and it's whatever the patient says. But based on her history, I cannot find anything that is, you know, even warranting her for fentanyl, honestly. But I don't mean I order it, you understand? I don't mean I order it. So she's getting her fentanyl. So I told her I'm not going to be ordering anything. And this when, like, when I was going through her list, I realized that she's also on the Norco. And then when I was going through her paperwork, I realized that they ordered morphine for her. So I say, okay, then you're on too much medications. You can go to pain management, and then from there they can decide what, you know, what they want to do with you. So she was upset about that. So I'm like, I really don't know what else to do, honestly. A lot of times we tend to find, hi, Dr. Shannon, welcome, thank you for the heart me. We tend to have a lot of patients be like, you know, hopping at one hospital to the other. You know, the polypharmacy thing, yes, it's very, very big. And then, you know, the narcotics, the crave, you know, the opioid overdose, yes, it's out there a lot, in every shape and form you can think of. You understand? Some of these patients, they will tell you that they don't want, you know, any surgery on their knee. They don't want that knee replacement because they just want in a pain. You understand? Because they want their pain medication. But I don't mean I order it, you know. I don't mean I order it, may I tell you. So I don't know if I'm a cruel person. I don't think I am. But when I'm already packed up with so much things, and when you're going through their list and you realize that they're doing private pay for pain medication, and you know they're also getting muscle relaxant, they're getting sleep medication, things like those. I don't really put my license in those kind of mix up thing. Yeah, I'll just order the regular medication, but when it comes on to your pain, you know, whoever has been ordering can always continue with ordering, but I'm not going to be ordering a ton of controlled substances for, especially chronic pain like that, you know. So, and then you can always see that, like, you know, the different threads in terms of notes with persons advising on different things, different options, but patients still say they don't want it. So she's upset, and yeah, I don't know if I'll go back and see her, because, you know, a lot of times if you don't order whatever it is that they need, sometimes them go ahead and, you know, tell you that, oh, they don't want you again, they want somebody else, you understand, or they want a different company. So that's just it. But yeah, so how are you doing, Dr. Shannon Simpson? I need to talk to you regarding I think it's home health. Is it home health business? I see you're doing, right? I think it's the home health business. Yeah. I say I wanted to start one. But you know, oh Lord, it's just like so much. It's just like so much. Everybody, you know, telling you different things. It's like so much things that you have to do, the directions and the paperwork and all of that stuff. So I don't know if you, with your business, if you have like a package with everything ready, and then we just come and say, oh, we want to do a home health business, and we just get the package and do the paperwork and we're done. Yeah, I don't want to be like, you know, starting up something and then having to be rushing left, right, and center to try and figure it out. You know, that way, yeah. Some persons tend to do that. So I hope yours is a little different. But that was my plan at one point. All right. Naf Eve. Okay. His worship Jad. How are you doing? Welcome. Yeah, it's lunchtime now. Oh yeah, it's almost lunchtime. It's almost 12 o'clock. So probably persons are gonna be out at this time. Yeah. So as I say, I'm just charting here, and I say I'm gonna be coming on. So feel free to go ahead and ask any question. All right, you can ask me any question. I'll probably just play some music. Remember, these United States are not united, so requirements are unique. Yes. That's what I realized. So yeah, you can always ask any question and I'll answer it. All right. But do join me on Thursdays and Tuesdays for our nursing live. All right, we're all nursing live, but we have our classes for NCLEX RE in our study session at that time. All right, at 7 p.m. on Tuesdays and Thursdays. All right. So let me get my little music going in the meantime to keep us company. And then from there, all right, let's see what's on my playlist. And my playlist is not as bubbly as probably some other person's playlist. So please bear with me, all right? Oh, I love this song. So I'll just play it. It's lunchtime. Kayla, how are you doing? How are you doing, girl? I love this song. Oh. Yeah, I heard this song the other day on YT. You see me look happy, Kayla? I don't know. I guess probably I am. I'm always in a good spirit, I think. Yeah, I think I'm always in a good spirit. I just think that if you're a nurse, you must always be in a good spirit. Because, you know, your patients are sick, the relatives are, you know, sad, they're feeling depressed, sometimes lost, and they just want somebody, you know, a familiar, not necessarily a familiar face, but a face that actually, you know, will cheer them up. Let's just say. They want a face that will cheer them up. They don't want to come in and see them relative looking sad, you know, they're last and die in bed for some persons, and then to see your face looking like a hot mess, like, no. So I think probably, you know, I don't know. Yeah. But I think I'm always in a good mood. I'm always in a good mood for the most part. I'm miserable though, you know, I'm a June girl. I'm very, very miserable. Otherwise. I'm a miserable person, I think. You know? I like things done a certain way, and so people will think that I'm a miserable person or I'm a perfectionist, that kind of vibe. No, I'm not, but yeah. You probably think that I'm a miserable person, but I just like order. That's all. Yeah. But I am known for my little smile. That's why I have to make sure so I have insurance, and or even if I don't have insurance, I have to still go and get my dental, you know, my teeth them look after, because I love to smile. The other day I was eating something the other day, and I was biting on the fork. I was watching the TV and biting on the fork at the same time, and I bite too hard. And I thought that this teeth gone. I mean, I said, how is it, like, you know, what's gonna be happening if I'm supposed to lose these two front teeth? Am I gonna be doing something like this? Because I love laugh, you understand? I love to smile. Or I'm gonna have to put in, you know, dentures. But I was like, oh no. I went in the mirror and was just kind of looking just to make sure that everything is fine with it, because I don't know how I would do it. Honestly, I don't know how I would do it, because I know I love to smile, and that's just it. Yeah. Sangster approach. Welcome. 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 All right. Yeah. You love to laugh, Kayla? Or you love to smile? Not necessarily laugh, because you don't really want somebody to laugh too much. You understand? We need to just have a pleasant face or just smile. Yeah. God bless, child. Welcome. Welcome. So Panther Walk, how have you been? How is your day going? Yeah. So that's just it. So what are you up to today, Kayla? Oh, you love to smile? Okay, nice. Yeah, I think it, you know, it takes away the stress of, you know, for some persons. Like when you smile, you know, and they see that and you look pleasant, you know, some persons it makes them feel a little bit relaxed. Some persons think that my smile is infectious, because once them see me start smile, them have to smile. I don't know, but that's what I was told. Yeah, that's what I was told. Let me send this young lady and see. I always see her, Kim the nursing student, to co-host. Let me find out let me see if she accepts it, and then I probably can talk with her or hear what she's up to. Let's see if she is there. This is the first time I'm actually sending out something to co-host with somebody. Yeah. Oh, she's actually in her car. Hi, Kim. How are you doing?
Good. Thank you for time for your daily. How you doing?
I'm doing fine.
I saw nursing, so I was like, okay, let me see who my nursing bestie is.
Yeah, Stacy here.
Hi, I'm Kim. Nice to meet you.
All right, you too. So, what are you up to today?
I'm a live host, so I was just trying to get on while I was waiting on these kids to get out of school.
Okay, cool. So, I see where it says you're a nursing student. You're in nursing school. Okay.
I am. I
Oh,
will be done December 18th. I'm actually getting ready to start my practicum tomorrow.
okay, nice. Excited?
I'm excited and nervous. It's like doing, you know how you do CPR for the first time?
Uh huh.
And it's like, you know you have been taught to do it, but you
Mhm.
don't know if it's actually going to work until you actually do it. So
Mhm.
that's the state of mind I'm in right now. It's like, okay, I know I've learned all this information.
Uh
I've
huh.
been an ER tech for 14 years.
Uh huh.
But now I'm on the other side of it. It's just like, is it going to work? Like, do I really know what I'm doing? And
Trust me,
so
it's gonna work.
I pray to God it does.
It's gonna work. Yeah.
Tomorrow, whether I wanted to or not.
Uh huh. What level hospital are you gonna be at?
So I'm in Atlanta. I work in Northside Atlanta. That's where I'm ER tech at, and I work at Northside Gwinnett in Lawrenceville, and I'm gonna be at Northside Atlanta campus for my practicum in
Okay.
ER.
Okay. Nice. So you want to be an ER nurse eventually?
I am. Yep. So
Okay.
my residency interview is next week for my hospital.
Okay. Nice. I'm excited for you. That was pretty. I love my clinical rotations when I was in nursing school. So I think you'll
I'm
enjoy it.
surprised that I'm like peds and NICU. I don't want to work there, but I do have a new love and respect for NICU and
Mhm.
NICU and labor and delivery nurses.
Uh huh.
But I also know that I don't want to work in that area.
Yeah, I did. After I graduated from nursing school, I did. It wasn't really a NICU. It wasn't really like a NICU, but it was functioning in the capacity of a NICU, and it was really nice. Yeah, initially I felt as though I was going through postpartum depression, dealing with those young babies and neonates. But then after a while, you get used to it. So I think I did about 9 months there. I did love it. And then, yeah, I was like, no, I cannot do this like, full time or forever. I can't see myself working peds forever. And, but I've always had a love for emergency room. So, okay.
So I had plenty of jobs as a tech and as a medical assistant, and when I went to the ER, it was like love at first sight. I've been there for 14 years and I've never held anything that long. I love it. I think it's the discombobulation of it. Like I think that my wires in my head run like the wires in the ER.
Mm-hmm.
So it's home. Like I love never knowing what's coming through the door. I love being a part of a great team because I worked at a couple hospitals like PRN part time while I was still at my hospital, and comparing the care from one hospital to another, like that's my home. Like our team is amazing. What we do is amazing. So I'm excited to be on the other side of it now.
Yeah, nice. Congratulations. Welcome.
What type of nurse are you?
So I do house call as a nurse practitioner now. So I've always done emergency room nursing.
So my end goal is to get my DNP in psych.
Okay.
So I have my associate in December, but I'm going straight into a BSN to I think it's BSN the NP bridge program, and then the end goal is my DNP.
Okay. So why do emergency if you or ultimately want to do psych?
So our emergency is emergency and psych. So we have a psych facility attached to our hospital. So we actually do both.
Okay.
But as you already know, when you come out of nursing school, it's important to get critical care experience because once you get that ER or ICU experience, you can go anywhere. So I don't want to limit myself to just doing psych because who knows, I might end up changing my mind. So I know that ER will open multiple doors for me.
Okay. Cool. That
So
sounds
ER is the start, or at least the start for me. Who knows? I don't know. I've been sticking with ER this long. I might love it and never leave it. I don't know.
Okay.
We'll see.
Okay. Are you thinking about doing any med surge or anything like that? Experience?
No.
No? Just. Okay. Okay.
No.
Yeah.
No. I had a couple of clinical. I already knew I wasn't out. You know, it's so before I did ER, I did like a year in oncology. And you know, you get to know those patients. You sit with those same patients day in and day out, and you get a connection. For me, I'm very sensitive. I'm an empath, and so getting to know the patients that much was really getting to me, especially when I lost them. So in the ER, I get to do what I do, but I don't have that long-term relationship with the patient. So if something doesn't work out, it's sad in the moment, but at least I don't really know the patient.
Mm-hmm.
So I just know myself, and I know to save my own mental health that it's better for me not to get an attachment with the patient and give them this care.
Yeah, that's true. That's true. Mm-hmm. Well, I needed something different. I wanted to start building relationships with patients. I wanted to hear more about the patients. So that's why I ended up in primary care. Plus, I never wanted to be working in the hospital 5 years, 10 years from now, you know, or when I'm older. So that was just it. I wanted to.
Older.
Huh?
I'm already older. I said I'm already older.
Oh, you're fine.
I just turned 40 last month, so.
Okay.
Well, I turned 40 in August, so yeah.
Okay. I'm almost there.
Hi, DJ, welcome in.
Mm-hmm.
So, but yeah, you know, and working in oncology is of course different from primary care. So I probably just messed myself up doing oncology.
Mm-hmm.
It was really rewarding to work in oncology, but I mean, on those sad days when you lose, I think the biggest thing for me was losing the patients that we thought they had beat cancer, and we lose them to something else because of the chemo.
Mm-hmm.
And I had one lady, she had run the bed maybe like a week or two before she passed. She was at Lake Lanier and trying to save a turtle and ended up falling into the lake and dying. And it's just like, you beat cancer and then to save a turtle, now you don't. I don't know, but I felt like I was coming to work every day signing the sympathy card, and it just began to wear on me. So I think I ruined the wanting to know my patient part because of oncology. Because they're the best type of patients, the most sweetest, humblest, you know, happy to be alive patients. Never had attitudes, very thankful.
Mm-hmm.
Which is different from the ER. You already know, but
girl. How do you deal with mental health? I know you say you've been working with oncology patients. I know with every patient that we come across, like, you know, they're stressing some days, honestly. But how do you deal with, you know, your mental health? What do you do in, like, you know?
I have a therapist. So after working in the middle of COVID in the ER, I did start doing therapy. I do have a psychiatrist, and I take my breaks when I need them. So if I feel overwhelmed with just what's going on, or especially if I get in like nursing school, I take my days. I prepare the others.
Yeah.
You know, and I just check in with self.
Yeah.
And definitely keeping God first has kept me grounded, and kept me you know, in a safe place. Because I always ask God to order my steps.
Yeah, that's the most important thing. You know, asking God for guidance and knowing when to take those breaks and asking for help, you know. Because nursing school.
I was going to say, yeah.
Nursing school is no joke. And especially, I heard you said you're waiting on your kids and you're still working. That's a lot, you know, that's a lot. So.
I'm an ER tech, and I also a Georgia realtor, and I have 4 kids. 2 of them are grown. My youngest 2 are 16 and 10. So yeah, I'm pretty.
They say the youngest one are what, 16 and 10? And the others are grown?
Yeah, 22 and 20.
Wow, you look nice. You look nice.
Thank you.
You're looking nice.
I see the bags under my eyes now. I'm tired, friend. I'm tired.
Okay. Well, I was just checking out I've never really done this before, so let me just see who is on and send the request.
Are we already connected?
I think so.
Oh, yeah. I think that was a little plus sign.
Yeah.
It was so nice to meet you. Thank you for stopping in.
Yeah, no problem. You too.
And I'm gonna reach out to you personally. I'm gonna send you a message.
All right, no problem.
All right, I'll see you later.
All right, no problem. Thanks.
Bye.
I don't know how to do to end this.
I got it, Grace.
Okay. All right. So Kayla, are you still here? I enjoy my mental health rotation. Yes, psych. I did enjoy my psych rotation when I was doing nursing in Jamaica or in nursing school because we did go to UWA. You know, it's a little bit bougie at the University Hospital of the West Indies with their psych patient, but it was nice. And then we also went to what's that place again? The psychiatric facility in Kingston. Bellevue. We also went to Bellevue. Bellevue was good. And when it comes down to the psych population or the patients, a lot of time you can't play around with their medication. They know their medication by color and name. And sometimes you're probably wondering, how is it that they know the medication? Yeah. And if it is 10 medications you're supposed to get, they know the 10 of them and what them feel like, what them look like, what them name. You understand? Don't play around them on the medication. It was a really good experience though. It was a really good experience there. I know I followed on I think it was on IG. I saw this provider down by Bellevue Hospital, and I think they're doing a lot of work down there. They're doing a lot of work at the facility. So I want to go down there and talk with a few nurses for my page. All right, I want to talk with a few nurses in Jamaica regarding my, just having them share little things about, themselves or working at different facilities, things like that on my YT page. Okay, yes, I want to talk to you as well. You being a nursing student, a mother, and a wife. I want to talk about what it is like, being a nurse or a nursing student in Jamaica. All right, and juggling all of those things at once. All right, me shy. You couldn't shy like me. I don't even understand how I ended up doing social media. I always, say I wanted to do it, but I've always been a shy person. But, as you go along, you realize that it starts becoming a part of you. The shyness kind of just, go through the door. Yeah, but people always, I always think that I was a shy person. Person always say that, no, I'm not. Because most of the time, like when I'm in college, I'm always like the group leader. I don't know, me decides to make a big group leader, I don't know me, but I always ended up, in those roles. And so I guess, I don't know, but I'm always a shy person. So I know what you're saying, Kayla, but for the interview, you can show your face and you don't have to show your face, all right? It can be an audio, but I would love to see your face. All right, we'd love to see your face. But we can actually talk about it. As I say, if you're shy, that's fine. We can always do an audio, just hear a little bit more about you. Or if you want to stay anonymous, that's fine. And you just talk freely. So I want it to be a place where we can share, stories from different persons, whether or not you're a nursing student, you're a nurse, a LPN, CNA, things like that. You're working in ICU. I want to hear about like a day in the life of a nurse, the real day in the life of a nurse, talking about, patient experience, things like that, what it is like working in ICU, the emergency room. Give me a rundown of your day, things like that. I definitely want to feature on my page. All right, it's all about the nurses. And then from there. All right, so Clover, Brian, welcome. I don't know who is on YT here, but thank you so much for tuning in. All right, remember to go ahead and tap up the live, folks. All right, tap up the live. You can also share it. And then from there, we'll get things going. Yeah, what time is it? 12:13. So are you off today from school, Kayla? Did you get a chance to finish your group work? And did everybody leave the group work on you? Because if you shy, I think you're probably the group leader. I just have a feeling say you are the group leader and you have all the work to do, and because you're shy, and I don't know if you're, 100% outspoken. Because if you're not, I just feel as though you alone do the work in that group day. Yeah, man. You alone do the work. And then everybody else is going to get their grades. Am I right or am I right? Yeah, because I remember when I was in nursing school. But as I say, after a while, for the male in the group, they will still do their part. But I'm not doing good. You understand? So it end up that I still have to do it. Yeah, but otherwise, the group was pretty good. The group was pretty good. I had, how many males in my group? there were three male in my class, in my batch, and I had 2 of them in my group. So I never really mixed up with too much of the female, you know, most of the time, which wasn't bad. All right, because you know sometimes when you have too much women in one group, a problem. Too much hormone is like problem. Still working on them. All my group members so far are doing their best, can't complain at all. Okay, nice. I love when we have that kind of teamwork because it takes off the stress off of one person, you know. If everybody, you know, carry their weight in the group, it takes a lot of stress off each person. And when especially, you know, you're depending on them. You understand? You're relying on them to complete it in a timely manner so you can put it together and make sure that the work, you know, the outcome that you're looking for in terms of the group work itself, it makes sense, you know? You can get the score that you want. When you have everybody coming together and doing their part, you know, it's always just good at the end of the year, at the end of the semester when you look at your scores, because your group work is always scoring a lot, and you know that that is a lot of weight. You know, so it's a lot of weight for your group work. So if everybody do their part and come together and make sure it's not late, then you know that's a plus for the group. I never mind it. I never mind group work. I never like it, but you know, it wasn't that bad. So what area are you working in right now, Kayla? Are you working or just going to school full time? Changes you made, maybe. Dion Dean, welcome. Okay, nice. You're working as well as a practical nurse at a children's home. Okay, nice. Do you want to work with pediatrics, the children, after you finish nursing? Or you want to spread your wings and try something different? I know you say you love mental health. You love mental health rotation. So I have it's a home for children with disabilities. Okay, nice. Okay. Not bad. I say I have, how many notes I have? Oh Lord. I have a few notes that I say I want to finish. And let me make sure I say I want to cancel my book because I don't want to see me violate. You understand? So let me turn my book the other direction. I'm saying that I can't understand anything about me. I tell you, social media, oh my word. You know, I don't want it to be a case where something happens and then I'm in hot water. No, I didn't know hot water with any nursing board. You understand? Because of violation of, you know, talking about any patient's name or showing it up on social media. Nah. Okay. Alright, that's the most important thing. Kayla. Alright, so I think I have about 12. How much notes I have? Yeah. I think I have about 12 notes. It's about 2, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 16 notes I have. So I try to do them in batches of 4. If I can do them in batches, then it makes me feel a little bit more comfortable with completing them. Otherwise, Marlene Love, welcome. Welcome, welcome, welcome. But why some of them are holding me back is because they're like annual visits and they're also post-hospital visit evaluation. All right, so those notes are a little bit longer than usual. So I'm gonna really enjoy them one day. You understand? Because especially the hospital notes, you have to go through so much pages to kind of skim through and see what they went in for and just kind of get a detailed notes on that. So that's why those notes are holding me back so much. And the more I put it off, you know, the longer them just stack up. Because then I see more patients the next day and then they're still there. And yeah, but I don't really like those notes. But otherwise, you know, it's not bad. How are you, Renee? And Crystal? Crystal? Crystal Brown. Crystally Brown. I'm gonna say Crystally Brown. Okay. Alright, so that's what I'm doing. But as I say, you can feel free to go ahead and ask any question. Alright. You can ask any question while I am here juggling my notes. Alright. And the notes are not that long. With the notes, they're kind of just straight to the point. You do your assessment, you have a diagnosis, whatever it is that you address, and your plan of care, and that's it. You close the notes and that's it. And then because this patient has 2 hospital visits back to back, she just get discharged from ICU after she spent 3 weeks in ICU. So she got discharged, like say for example, yesterday, and then she went into the emergency room today for pain medication, and then I saw her tomorrow. So I have that visit and then the other visit. The second visit is not that long, but I still have to make mention of it. But the admission for the ICU, that one is going to be a little bit lengthy. So I have so much paperwork that I have to go through on my tablet to make her notes, her post-hospital follow-up visit note. So I see patients like, you know, so when the patients go into the hospital or if they go to rehab, they get, you know, discharged, coming back to the service, I have to see them. So we do the post-hospital follow-up. If they have a fall or if there's something acute, I go in and see them. I also do, well, I don't do pain management because I refer, the practice does have somebody for pain management, but otherwise I will still go ahead and order medications for them. Just make sure that I'm checking the medication record, all right, that they have. So just in case they decide to fly into Oklahoma to get pain medication and then come back here, at least I can pick it up. So wherever they get prescriptions for narcotics, I'm able to see it. So I feel a little bit more comfortable ordering their medications that way, because if they do private pay or if they've gone anywhere to get the medications, I can always pull that up and order their pain medication. So that's not that much of a problem. But if the company does have a pain specialist or pain management team, then I'll definitely refer them to see that patient. What else we do? We do the regular admission, you know, discharge every now and again, because sometimes patients don't want the service. Sometimes we do get patients over to hospice, so we don't see hospice patients. A lot of times when the patients are on hospice, then the hospice team will see them. Unless it's a case where the patient has some diagnosis that hospice don't want to see the patient for, then I end up seeing them. But a lot of times I let hospice just do their thing. All right. A lot of times patients might need a wheelchair, they might need a hospital bed, a cane, diaper, you know, incontinence supplies, things like those. I'll do a visit to see them so I can order those. So even though it might sound simple, that like, you know, a wheelchair and a cane, Yeah, it's a big money business out there for some companies. So I don't just take it that the patient needs a wheelchair and the patient needs a hospital bed and just write an order for it. No, I go in and I see them, evaluate them, make a note to say this is why they need it. Is it a case where they're always falling, they're bedridden, things like those? Then I will put in the necessary, note. I'll do a documentation as to why they need it, and then I'll do the DME order. Because you have some people that, they make money off wheelchair, Medicaid and the wheelchair and all of them business there. So it's a lot of funky, shady business out there regarding, DMEs, durable medical equipment. So when it comes on to wheelchair, hospital bed, all of those things, orthopedic devices, a lot of companies are, not doing it the right way. And so they get into different, situations with the law because of that. So even the company, patients can call in and sometimes they'll be like, okay, yeah, the patient needs it. I personally go and see them, because just think of it, just like when you have a regular primary care provider and you're supposed to go in and see them. You don't just call them and say, hey, doctor, send me a prescription, become head or hurt me. No, you have to go in and you have to pay some money to see the doctor, right? So it's the same concept. It's not one fee for the month, and if you have 1,000,001 things you need to address, then I address it. No, it's not like that. And that's what a lot of times the patients fail to understand, that it's not a one fee, it's not a one money, and you get a bed, you get a wheelchair, I come in and address you 4 or 5 times, or you can call and say, hey, today I'm having a UTI, 2 weeks later, I'm having chest pain, or the next, couple of weeks later you want like a referral for, psych or something like that. No, like each of those are different visits, and I make sure I have documentation, and from there, I bill them or bill the insurance. So yeah, so we do a lot of those. What else? And we do a lot of coordination with like different services, when we have patients that do need like lab work, EKG, the company that I'm with or other companies, they will have services that they work along with. So when it comes on to laboratory services, then we have somebody that is our go-to company that does that. When it comes on to your x-rays, your EKG, ultrasound, ECG, things like those, it's the same thing. So sometimes it might take a little bit longer. It's not that bad in terms of like blood work, depending on the company, because this company, blood work, you'll get a turnaround time in like 1 to 2 weeks. Most of the time in 1 week, they'll get the sample drawn and resulted. So I'll get a chance to go in and speak with the patient. Nowadays, I'm not doing any virtual visits, because with the Medicare patients, I think they've changed the law regarding virtual visits. So if any patient call in and say, oh, they're having UTI symptoms and I want to talk with them regarding what's going on, how long, what they've been using, I cannot do it on the phone unless I do free service. I can do it, but I'm not going to get any pay. You understand? Because you can't send it off a billing anymore to Medicare, because they're not paying for that. So if a patient calls in and they're having new onset, UTI symptoms, they're having chest pain, and a lot of times they probably, like if they call in with the chest pain, I'm not going to go and see them, because it'll be unfair for the patient, because I know that the chest pain is not going to do anything. You understand? It's just that sometimes you have some patients who are just so stubborn, they'll tell you that they're not going to no hospital. They ain't going to no hospital with the chest pain, the vomiting, the sweating, and one side of them body just, weak and all of them stuff there. They're not going there. So definitely I will go in and I'll see them and tell them the same thing again that I would tell them on the phone. But if if somebody called and said that they're having chest pain, I'm not going to bill them for it. I'm just going to advise them, this is what I want them to do. And I'll go ahead and make a little documentation and sign it. But I'm not going to bill for it. But if they're stubborn and they don't want to go to the hospital, then yeah, man, me drive and go see them. You understand? I will drive and go and see them and tell them the same thing. You need to go to the hospital. But in the meantime, if you don't want to go to the hospital, you understand, because you can't call 911 and say, oh, the patient want to go, and then when the ambulance service come, as I said, them stubborn, them not going to go on the ambulance. You understand? So the only thing you can do is document what you did, what the patient says, and then that's it. But in the meantime, what I will do, if they say they're not going with their chest pain, I will go ahead and order the EKG, the blood work, the chest x-ray, things like that. If they need additional medication, I'll go ahead and do that. But I also let them know that the result ain't coming back until probably like a week or two. So if they're having a heart attack, we ain't gonna know anything, you understand? We ain't gonna know anything until 1 week or 2 weeks time. And knock on wood, if them survive, you understand? So I literally just be plain and straight with them. I tell you, say, this is what is gonna be happening. You understand? So that's just it. So we'll have all of those that we offer. We have social workers that we work along with. The practice also has a psych. So if we have patients that have any psych diagnosis, they're taking medications, then usually I like to have psych just see them, evaluate them, and then from there. Most of the patients, they will get their annual wellness visit done as well. So we do those, their yearly or their annual visits. Most of them tend to not be able to go to get certain things done, like their colonoscopy, mammogram, depending on what's happening, because they're bedridden. Sometimes they're not bedridden, but they don't have any family member to come and see them, to take them to the appointment. Some of the family members will tell you, say, that's our responsibility. So I really understand how is it that it's our responsibility to find, ride to bring patients to appointments, to get a mammogram, to get a colonoscopy, so things like that. Sometimes you hear the patient's relatives say something and you're wondering, okay then, like, I don't really understand what's going on. But yeah, sometimes they'll tell you that it's our responsibility, and we just have to let them know that no, it's not our responsibility, it's the patient and the family. So we'll tend to do a lot of that. But if we are able to coordinate certain things, we try to do that as much as we possibly can. All right, we try to do that as much as we possibly can. But even so, sometimes you still make the appointments, but not necessarily the appointments. You get the referral done, you set them up with a specialist, and the only thing they're supposed to do is answer the phone and tell them when they're available for, the evaluation or the appointment. And sometimes them still don't make it to the appointment. You understand? They still don't make it to the appointment. And it's not like, not saying that they don't have anything doing, but 3/4 of these patients are not working. They're not working, they're bedbound, or, they're bedridden. You understand? Some of them have virtual appointments that they can do. They're not showing up. They're not showing up for it. So, there's a lot of challenge that we have in host call service, but at the end of the day, I feel it's a really good service that we're offering. Not necessarily my company is pretty good. I love the company that I'm with, but in terms of what we offer to patients in the home through the host call service, I feel it's a really good service, especially when it comes down to the home health aides, because they serve a lot of purpose, and sometimes we might not give them the props that they need. And I think, they're like the backbone of home health. They're like the backbone of home health, the community, the patients that we're serving. Because when family members are not there to spend that time with their loved one, it's the home health aide that is always there. They're there from like 8 o'clock in the morning until 8 o'clock in the evening, depending on the insurance, all right? Depending on the insurance, because you have some persons who have insurance that will cover probably 4 hours throughout the day, 4 hours per day for like 5 days. Some companies will give you 8 hours, 12 hours for 5 days. So it depends on the insurance that you have. All right. So some persons are just blessed with that. You have some persons who are not. You understand? So with the home health aid, when you have family members who are not able to stay with their family members or the patient, you have those home health aid that are always there. Always there, just sitting down, listening, caring for these patients, identifying whenever there is any change in the patient's behavior, because 1 or 2 times you might have a nurse going in once a week to see the patient, but you have your home health aide there around the clock each week. And so, yeah, that part of the service is something that a lot of patients rely heavily on. Because they don't have family members. I have this 95-year-old patient who lives on a 2nd floor of an apartment, and her daughter, she says, lives about 5 or 10 minutes away from her, and she hasn't seen her daughter in probably like say 6 months. You understand? She hasn't seen her daughter in 6 months. Her daughter loves to travel. Her daughter is retired, and she's going, I don't know if it's Bali she's going. think it's Bali, she said she's going. And she said she's worried about her daughter. So I said to her, I said, Mom, why are you worried about your daughter? Why are you worried about your daughter? I'm not an insensitive person or anything. I'm like, you're 95-year-old. Why would you be worried about your daughter? Your daughter lives like 5 to 10 minutes away from you, and you haven't seen your daughter in 6 months. And you say she hardly calls. Why are you, stressing yourself about your daughter at this age? Like, she's an amputee. You understand? She has a right above the knee amputation. She's wheelchair bound. She lives on the second floor apartment. Since December of last year, the elevator for that apartment has been out of service. They're working on it, and they gave her the option to move into the first floor. But she says she's been in that apartment for, I think she says like 15 years or something like that. She's been in the apartment for like about 15 years. It has been a long time. She's been in the apartment. So she doesn't want to leave the apartment. And I totally understand, because at her age, when you think about familiarity, she know that right here she has, this going on. Things are stored there. So just to go ahead now and move her into another apartment, it's going to confuse her. You understand? It's going to confuse her. So I totally understand her when it comes on to, not wanting to move. But in terms of ambulance service, I said to her, how are you thinking about, if you're supposed to get sick and you call the ambulance, or someone calls the ambulance, how are they going to get up? You understand? Because the elevator not working. Not saying that the person on the floor might not get sick and need ambulance as well, but she's my patient, so I'm just giving her, the different things that I'm thinking about in terms of emergency. So she's like, well, I think they will figure it out. So I said, no, sir. But she's like so worried about her daughter, and I'm like, you haven't seen her in 6 months. She lives like 10 minutes away. Like, stop worrying about her. Like, literally stop worrying about her. You understand? Stop worrying about her, because your blood pressure is high, and she's saying that she thinks it's because of the fact that she's worried about her daughter going to Bali. She says that her daughter loves to travel, and she doesn't normally worry that much whenever she is in the country, because she is, going outside of the country. She's a little bit worried about her. I said, stop worrying about her. You understand? Stop worrying about her. And she's like, yeah, because she doesn't worry about me, because if she was, she would be stopping by. So I asked her, does anybody help you with cooking? No, she cook, she clean. And as I said, she's wheelchair bound. She cooks, she cleans, and her place is like so clean. It is like so clean. You wouldn't even think it's like, a 95-year-old doing all of this. She's scrubbing the floor, she's scrubbing the mat, like, the carpet, and her place is just like looking spick and span. So she said she does all of this herself. You understand? So we know some of us are out there and we say that we can't do anything. If you have a person that is an amputee, 95-year-old, they're doing it, I'm sure you can do it too. I'm sure you can do it. You understand? I'm sure you guys can do it. So don't let it be a case where we say that, oh, it's because of, the back pain. No, she have back pain too and she's doing it. You understand? We still can do one and two things. It's whenever we don't do anything, the back pain is going to make us, even feel a little bit more awful than how we do, how we are. You understand? So make sure you're exercising those little, bones, those muscles. All right, free them up a little bit, because if we don't free them up, that's when we're going to have a lot of pain. You understand? That's when we're going to have a lot of pain. But yeah, so she is always, so back to the home health story. So she's always looking forward to having me come in once a month. She has a nurse that comes in once a week, and then she has a home health aide that come in 2 times per week. You understand? So she's always looking forward to us visiting, because she says she doesn't have anybody else. She doesn't have anybody else coming to see her. And for a lot of these patients, as I say, it's just sad. It's just sad and, depressing, because sometimes they don't even have a TV in the room, They don't have a TV watching. I have one other patient that every time I go there, I'm like, okay, then what's going on? He's always sitting down at, he's always sitting down looking through. He has a really big glass window. So he's looking towards the road, but at the road there's like a big tree, so you can't really see anything. So it's just a bunch of leaf and everything you're seeing. You understand? The branches and everything coming down, and he's always sitting there. So I said, do you have a TV? And he pointed. So I don't know if I remember them TV there from a long time. You understand? I remember when I was growing up, we had one. It's a black and white TV. But his TV, it looked gray. You understand? The screen looked gray, but it's not working. It's not working. It's like one of those big TV with the big back on it. Yeah, man, when I was younger, we used to have one and we used to knock it like this whenever we couldn't get anything, any signal. Or, I don't know what had happened. Yeah, I think it was like, you usually some line in it. So you used to have to knock it so the rice grain can come out of the TV. It's one of that the gentleman have, like, looking at. And I'm like, does it work? He says, no. He says, no. I'm like, oh my word. So you're sitting in this house and the only thing you're doing is sitting in a recliner for the entire day. And the recliner, not the recliner, the wheelchair, is a motorized wheelchair. The motorized wheelchair, the arms are gone. You understand? Because he has gotten it, and a lot of times you don't really understand that there's a time period when you get your hospital supplies or your wheelchair, your bed. The insurance only approves it and you get it, and then you can't get another one until probably like say 5 years or 6 years time. So his chair is like, the sponge and everything on the seat is gone, and the armrest is gone, everything. It's not really working. He has to be using his legs. This is an 87-year-old having to use his legs to help with moving this motorized wheelchair. And it's just so depressing. It's just so depressing, you understand? And then when they try to call, like, the company that supply them to say, hey, my chair popped down. My chair is actually broken. It needs repair. They can't get anybody. It's just giving them, like, voicemail. And when you put in a request to send out to say, okay, you need a new one or you need it repair, they're going to come back and tell you that last time the patient got one was 6 years ago. You understand? And even when I try to make the best note to say, okay, then this is what the chair look like. You understand? You take picture and you try to upload it and send it. This is what the chair look like. They might try to repair it. So that's just it. He's sitting in one of those one of those motorized wheelchair that is like falling apart. Him dropping out of the wheelchair, 87-year-old. He lives alone. He doesn't have a TV, nothing to keep him company. And the only thing he's looking at is like a big tree that has a lot of, leaves just hanging down, because he is like almost like to the end of the road. So no cars now pass by, nothing not passing by. And it's not like in some places where you hear the horn, people can come and toot and you know that somebody is outside. Nothing like that. People don't really blow horn or foreign unless, what I call it, them angry, road rage. Yeah, but people don't really toot horns and all of those things. So it's not like he has like traffic or anything passing by. So the place is just so quiet. So I said, so what do you do in the daytime? He says, sleep. I said, sleep? Me tired when I sleep for probably like 6 hours. You understand? If I get up, if I sleep in my bed for probably like 8, 12 hours, try to sleep for 12 hours. That has never happened before. But I just feel like, if I'm supposed to try to sleep for 8 hours, I'm going to wake up too tired. Yeah, I'm going to wake up tired. So can you imagine these patients are home, they don't have any TV, they sit up for a few hours, go back, go sleep, then they wake up again and go back, go sleep. And every day that's the same thing you're doing. And not to mention that 3/4 of these patients, their vitamin D levels are low. You understand? Because they're not getting in sunlight. So if I am feeling groggy some days, you can imagine these patients that are not doing anything, how they're feeling. Yeah, it's just sad. It's just sad. So when I go out and I see these patients, I don't really know what to do sometimes. I wanted a change of scenery. I needed a different pace. But I'm telling you that when I see the trauma, we can deal with them. They're a little bit different. You understand? I deal with those a little bit different in the emergency room. But now coming in the home setting, the community setting, and seeing all of these things, it's depressing. That stress me out. You understand? That stress me out. But not to the point where, I go cuckoo. But it is stressing. It is stressing. And so that's why I said, when it comes on to healthcare workers, a lot of us, we are dealing with different things. All right? So I deal with a lot of things out there. You're seeing a lot of things out there. I want to don't have anybody to talk to. Yeah, man, find somebody and talk to. Find somebody and talk to. Because as I say, a lot of things that I see out there, it's depressing. Not to mention you have some persons who are working in psych. All right? They're working in psych, and just imagine those people now end up hearing some stories that you had a situation before. I think I did a video regarding that. But you think that, you had some childhood issues that got resolved. All right? You have some childhood issues that got resolved. And No, you're working in psych, you're working as a nurse, you're working as a CNA. So it's not only psych, you know, not only in the psych area or field, but you have some issues going on years ago and you think that they're resolved, and no, somebody come and sit in front of you. You're in the emergency room and you hear about a rape case, and you know that you probably had been through something similar to that. You understand? And you think that because it's a couple of years ago it happened and you get past it, and then no, somebody come in front of you and sit down and start talking to you about it, and then it bring back so much memory. You understand? You thought that case closed long time. It bring back so much memory of, you know, the trauma itself. And then you're dealing with this. You're providing support. You're supposed to be trying to provide support to patients. You understand? Try to provide support to patients or even your own colleagues, you know, because depending on where you're working, because if you're working as a psychiatrist, you know, in a facility that is accepting patients, their staff, you know, you're working for a hospital that has a department that deals with mental health, and you're working with those persons, and one of them is, you know, your own colleague. They come in and they sit down and talk with you and share certain stories with you. And deep down, you know that you're going through certain things and you don't have anybody to talk to. You understand? Because people are coming to you for advice, for help. And you have all of this thing going on now. You don't have anybody to go and talk with. You understand? So find a support system. You understand? Find a support system. If it means you're going to create a page, a TikTok page, I want to come, I want to chat. You understand? You don't have to have a face. Create a page or something and come and just talk about certain things. Hear how persons are, you know, doing. Share how things are going with, not necessarily with you, but at least, you know, you can put it out there and persons will have, you know, answers. Sometimes they'll have answers. So if you don't want to go to somebody like a friend, because you think your friend does chatty, you know, and them can't keep anything and them are no fridge, yeah, man. You can always find other persons out there. You understand? You can always find other persons out there to talk with, and they can provide you with insight. They can provide you with advice. You understand? So don't let it be a case where you're dealing with certain situations. You're seeing certain things out there and it's causing you drama in your life. You understand? After you leave work, and then it pushes you to do certain things that, you know, at the end of the day, a lot of us are saying, if we did know, or I wish I was in a position to help that person, but it is just too late. All right. So if you're going through situations, you're seeing certain things going on, find that 1 and 2 person to talk with them. You have, you know, peer groups online, support groups online. You have your friends, you have your family member. But as I say, sometimes you probably don't want to talk with your family member, and we understand that. You understand, because not everybody will want to know your business. So we totally understand that. But you have some persons who are definitely close with their family members, and you know that 1 or 2 of your, you know, your auntie, your uncle, your sister, your brother, you can actually trust them. Then go and talk with those persons in privacy, you understand? And hopefully, you know, that will help as well. But yeah, but it's depressing a lot of days. But it's not depressing to the point where, as I say, it's affecting me like that. Because as I say, most of the time, I don't know. I think I'm dealing with it. I try my best to help the patients. I don't bring it home with me, like, you know, make it be a part of my, no. But I do think about them, and I try my best to follow up on certain things that I'm doing for them. And then from there, all right, I try my best to follow up on certain things for them. And a lot of times, you know, as I say, sometimes it's just, you know, even if I get the home health aid, I feel a little bit better. So even though sometimes a lot of things I might order it and I don't get approval for it, but at least if I get a home health aid that is able to go there and keep them company, at least I feel good. It doesn't have to be 8 hours. We can cut it up into, you know, 3 hours a day, or 3 hours or 4 hours every other day. Then we feel good about it, you understand? Because at least they have company. They have somebody that they can talk to, and that's the most important thing. So yeah. All right, thank you guys for tuning in. Margaret, welcome. Paulette, Matrix, Leon Thompson, I don't know if these folks are here. Ajay, thank you for the follow. All right, thank you for the follow. Oh, I think it's because it's lunchtime. Everybody there on lunch now scroll through internet. Not true. If you're joining me for the first time, just go ahead and just put a heart in the comment box below just to say me, you know, that kind of vibe. Anna, Marie, welcome. Just go ahead and put a little heart in the comment box, or just say hi. All right, so I can call you by name. All right. But yeah, I'm Stacy. I'm Stacy. I'm a nurse, and I do house call. I work as a house call nurse practitioner. I'm originally from Jamaica, just in case you hear the accent. I'm originally from Jamaica. Was trained in Jamaica as a nurse, and then I did my master's here as a primary care. I did adult gerontology, primary care nurse practitioner here in the States, and I needed something different. So here I am, not on social media, but here I am doing house call. So if you're new and you haven't subscribed or followed the page, go ahead and do so. You can also come over to my YT page and check out my content. I have long form contents over there. I talk about my, growing up. I'm not from a wealthy family. I'm not from a rich family. Me consider myself poor. But not until I come to America, I realize that, my kind of poorness totally different from the kind of, when it comes on to the different levels of being poor. Yes. All right, but I would say that I grew up, not really say poor, but, when you're in Jamaica, somebody might say you're poor because you probably have outside bathroom, you never have electricity and all of those things. So that's what I consider to be poor. But then when I got here, I realized it's a little bit different because you have some people whose situation was just like, in 2025, 2016, 2017, 2017, that is worse than my experience when I was growing up. So that's what I'm saying. I know I was saying that I was poor, or I think I was poor then, but then looking at it years later, I mean, I really consider myself poor. All right, I mean, I'm brag about it. I'm just being real. All right, I don't consider myself being poor, but back then, yes, really poor. But anyways, let's move on. As I say, I grew up and I talk about that on my page. So you can always go over there and check it out. And if you have any questions, concerns, you can always reach out to me. But my page is more of, something for motivation. It's something to motivate you, inspire you. I share my story and I want to talk with other nurses so they can share their story and inspire other persons as well. So that's going to be a part of my podcast that I'm trying to work on. And just talking with a lot of nurses, So if you have a story to share, feel free to go ahead and hit me up. All right, and we will have a chit chat. Bad girl Anna B, how are you doing? Yes, how are you doing? Nice having you here. All right. George Massimo, Raymond Gauntlet. I think probably these persons are not here. So who is currently here? When I can't just put the two little heart in the comment box. I see two persons on the live here. When I can't just put the two little heart in the comment box just to say that you're here, or just, you know what? Just tap the live. Tap up the live just to, to like up the live so I can see who is here. Carrie Ann Brown, how are you doing? I wanna do hide. Are you guys hiding from me? Because that's what I'm going to say. And I'm going to say, no, hide. Oh, Ajay, you're here. Thank you. Carrie Ann Brown. Okay, nice. That's what I was going to say. I think you're not hide from me. I was thinking that you guys are hiding. Yeah, because on YT, a lot of times, my folks on YT, they'll show up and they'll be sitting over the entire live. And I feel as though they're enjoying the content, I'm going to say that they're enjoying the content. But a lot of times them just sit down and watch the content and they do not tap the screen. And I'm not complaining, because I'm getting the content out. So I'm not really like complaining or anything, but yeah. Hello, Glenn Good Sharon. Welcome, TS Music. Welcome. How are you guys doing? All right, Carrie Ann Brown, thank you so much for liking up the live. How are you doing? Yeah, so that's just it. Judice, thank you for joining. Where are you joining in from, Ajay? Ajay, where are you joining in from? And TS Music, where are you joining in from? Positive thinking. Okay. Yeah, where are you joining in from though? It has been a good day, I must say. All right, yesterday my day. Oh, you're from Jamaica? Okay. Life with Marsha, welcome. Yeah, yesterday my day was okay. Yeah, could have been better, but today it's good. Alright, today it's good. Chevy, how are you doing? I'm doing good. We're listening to you here on the job from Brooklyn. Okay, okay. Thank you for doing so. All right. What's the weather like in Brooklyn? Is it like cold or hot right now? But I'm using my bro phone. They stole mine. Oh, I'm sorry to hear, Ajay. I'm sorry. I'm sorry to hear. Okay. Yeah. Hopefully one day I'll go to New York. Probably for what time of year is it? I don't know. Probably for the winter, for the fall. I don't know. Yeah. Probably want to go to New York one day. It's a bit chilly. Okay. Okay. Not bad. That's not a bad weather. That's not a bad weather. Or probably one year. I'll probably try to go 1 year when it is the winter. I don't know. Probably the winter. When it's a little bit colder. And probably snowing. I want to experience that. So I guess I'd have to plan for a New York trip. Okay, but that doesn't sound bad. Alright, Toussaint M. Welcome, welcome. I want to experience the New York weather. I did a little bit of time in not New York, in Maine, and it was cold. I never really experienced much of the, the snow. So I'm thinking that I probably can try probably a day or 2 or 3 or 4, I don't know, of probably New York, and probably do a little shopping there as well, but we'll see. Love me, welcome, welcome. Where are you from, Carrie? Where are you joining in from? Yeah, I'm actually in Texas here. Oh, you're from Jamaica? Okay, yeah, that's where I come from. That's home. Lord, I can't wait to go back home. I miss Jamaica. I miss Jamaica. I wish I could go home like every 3 months or every 4 months. Yeah, I wish I could go home every 4 months or every 3 months and spend at least a month down there. Or I wish I was earning US dollars and working from Jamaica and probably go to Florida. Just probably do a trip to Florida just to say, okay, then keep my license active. You know, that kind of way. Yeah, man, I would be happy. I would be happy. Because at least I could probably eat a patty right about now. From the other day, I'm thinking about a patty. I need a patty and a Big Joe. You understand? Or a fresh orange juice. That's what I feel for right now. Yeah, or probably go down a little Ochi, get a brown stew fish and some festival. Oh Lord. And no, I'm not pregnant. If you're from Jamaica, you're thinking, nope. That is just what I feel for. Alright. We need a patty and a cocoa bread. The last time I came to Jamaica, cocoa bread seemed like it did, them stop make it. Because I was coming from all the way in Montego Bay and trying to get a cocoa bread and patty. And the only thing I was getting was the patty. I am from Manchester, South Manchester, country. I'm a country girl. Good, yes. I said I couldn't find no patty, no cocoa bread. But the patty was good, but I couldn't find the cocoa bread to go with it. I mean, I sing on that on the plane from a long time. So as soon as I reach in, I think it was Trelawney. I think it was Trelawney, the closest patty. Like, I didn't want to do any detour or anything. I mean, I tell you, so when I go over to the Juicy Beef, them say them not have none. Them not have no cocoa bread. They haven't had cocoa bread for a long time. And I'm like, what do you mean by you not have no cocoa bread for a long time? You understand? And then I drove all the way into Spanish Town and it was the same thing. Them not have no cocoa bread. Reaching a toll gate, them not have no cocoa bread. And I said, no, sir. This is serious. This is serious. Never ended up I had any patty and cocoa bread for the little trip that I was there. I had other stuff, you know. Never have no KFC because I never really feel for no KFC. It was just the patty I wanted. I just wanted patty. I wanted the patty and the cocoa bread. And then I got my box food, you know, at Banco Mall. Yeah, man, I have to go Banco Mall and get my box food. So now I'm just sitting down and just thinking about it. Yes, I feel like I'm gonna go on a plane right about now to go to Jamaica to get some food. Them never have any at Maypen. They never have any at Maypen, in Maypen there. May I tell you, it was so sad. It was so sad the whole trip. The whole trip, me I stop at patty place and I buy only patty. And couldn't get the little cocoa bread to go with it. And then I tell you, I missed my flight. I missed my flight because I end up on stop for breakfast. Because I wanted ackee and saltfish. I wanted ackee and saltfish the morning. So I stop on Maypen. Stop in Maypen and order my food. But then you know you get the fried dumpling. The fried dumpling is warm, it's hot, and the ackee is hot. You can't make it get cold. So I actually park up in the parking lot. I mean, no, so I'm late and I know I run late. I know I was running late because when I was looking at the time and I'm like, okay, I'm in Maypen and it's after 8 and my flight is at 12. There's no way I was going to drive from Maypen, go into Spanish Town, and then go all the way St. Anne and then Montego Bay and make it in time. And I tell you, it was like a roller coaster of event that happened that day. Because when I was driving, I decided to do a little overtake because I see the road clear. And yeah, I never know that a police hold up the road. You understand? And so I ended up getting pulled over after the police, you know, decided to put on them lights. At the time, they had just gotten, I think they started, what was it that they're driving? What is it that they're driving in Jamaica right now? They're driving Volkswagen? I think it's Volkswagen they're driving. They're driving Volkswagen. So I never see any police vehicle, you understand? But all I know is that there was this long line of traffic. But I didn't know why nobody wanted to go around. So I said, okay, let me just try and go around. And when I go around, I only see the lights then behind me and I'm like, oh my word, what's going on? What's going on? So anyways, you know, police pulled me over. I'm already late. The police pulled me over and was asking me, you know, what was happening. You know, where you going? I said, I go home. I go back to Texas. You understand? I'm going back to Texas and you say, you know that you're not supposed to be overtaking here. I say, I thought it was like a long I thought this was like one of those overtaking zone. And they said no. So I said, can I see your license and your registration? So you know himself if you can see my license and registration. So I say yeah. But me already just get a ticket in Mandeville because I was about to stop to pick up my mommy. I got a ticket, but I never stopped, you know. I never stopped the day before. I didn't stop, but anyhow, the lady, she decided to tell me to stop because I saw it was like a no stopping zone. And my mom was there, so I was like literally pulling over to go ahead just have her step into the car. Because everybody guilty of it. And I saw the police, so I'm about to stop. You understand? I continued driving, but then, I think probably a little bit of an ego. It was a female officer, so she stepped out into the road and I pulled over. And she said, that this is a no stopping zone. And I said to her, I didn't stop. I was about to stop, but then I saw you. You understand? But I never stopped. And she's like, yeah, registration and license. So I went and give her the registration and license, and she gave me a ticket. I said, but I leave tomorrow. She said, yeah, you'll have to figure out how to pay it. I'm like, oh my word. So that was my first ticket ever in Jamaica. All right, my first ticket ever in Jamaica. And so I left the ticket with someone to ask them to pay for it, pay it at the tax office. And then from there, and then that day, when I was leaving, the police was like, I said, let me just get a ticket in Mandeville. I just got a ticket like yesterday in Mandeville, and it wasn't because of this. You understand? You must say, well, you know what, you're late for your flight, you're already late. So I say, yes, and you're gonna make me late even more. I was like, yeah, I'm gonna write you a ticket. Can I have your driver's license, your Jamaican driver's license? I said, I don't have one. Coming out my Jamaican driver's license that was active at the time. You know, I said, I don't have one, I have my international license. So he's like, do you know your TRN? I said, no, I don't know my TRN. Because you know your TRN and your driver's license is the same number. I said, no, I don't know my TRN. I don't know my TRN. Like, that has been out of my mind for like years now. You understand? So, he was like, all right then, all right, I'm going to let you just go. Well, me tell you saying that it was a police vehicle that had, so there were two Volkswagen, the SUV Volkswagen, and there was a Noah bus. I don't know if those police were going to a conference for superintendent, but when I tell you, it was about 2 dozen police. Because both Volkswagen decided to come around after me pass. And then the Noah bus come around as well. So when everybody come out of the vehicle, they were like, oh, it's you driving. I say, yes. I say, but I never know that this is what Jamaicans are driving now. The police them down here are driving now. Because it never mark up. It never write police or anything on it. But anyways, you know, it was a good encounter. He said, drive, you know, don't do it again. And I was like, yes, sir. And I just went, you know, on my merry way. When I reached the airport, 15 minutes ago, them locked the gate. So, you know, that cost me an arm and a leg to get what? Another flight, because the next flight was gonna be a stopover. I mean, I have no time. I like, you know, I don't like stopover. I don't like connecting flights. So I had to get I wanted a direct flight. So I got one and then got on the next plane and then leave. So I'm like, oh my word. Never again. Never again. Renee, how are you? Yeah, so that was my little, you know, saga at the time. But yeah, I miss home. I miss home a lot. I miss home a lot and can't wait. Oh, you're braiding? Okay, cool. I think I saw something here. Where are you from? Oh, Blasey is asking. I'm from Manchester. Girl Chester? Who's going to get upset on the live right now? I'm from Girl Chester, Manchester. Alright, that's where I'm from. Mandeville, Manchester. Yeah, I'm from a little country area down that side. But I like driving that direction to go Montego Bay. Yeah, I don't really drive St. Elizabeth. I think even though the trip would be shorter, but I like driving through Clarendon, Spanish Town, go up in St. Anne, Trelawney. Yeah, it sounds a lot. Not true. Yeah, it's a lot. It's a lot of a drive. You're from Trelawney? Brea. Okay, cool. Yeah, so that's where I'm from. So that's just it. But I prefer that route than to go. I guess probably because I don't frequent St. Elizabeth side, Newmarket side like that. So I don't really take up that opportunity to explore it that much. So yeah. But I go through Maypen. I go through not Maypen itself, but Clarendon Park, because I'm always have ackee and sawfish. Yeah, man, I love ackee and sawfish, you know. I remember when I was in nursing school, and I tell this in my story. When I was in nursing school, ackee and sawfish was my #1 meal. Yeah, I never had any money, and you know, ackee come in pods of 3. So buying ackee downtown, if you buy 6, you get what, 18? Yeah, so that was enough for me. You understand? And plus, I think I was slim them time there. I never really eat that much them time there. So when I go and buy ackee, it was I get a good amount. You understand? And ackee was very cheap at that time, much less sawfish and then yam. I was doing a lot of yam and dumpling because as I say, I'm a country girl. I'm not really a fast food kind of person. So I normally would cook my food and then you know, pack it for school. So every day I warm up food. After a while I get tired of it, but I love ackee. I can never get tired of ackee and sawfish. So that was my go-to meal in college, like every single day. Like every single day. It was ackee and saltfish, dumpling and boiled dumpling. Boiled dumpling and yam. Yeah. So when I tell you, when I go to Jamaica, if I don't get any ackee, my head hurt me. Ackee and chicken back. Oh Lord. I've never really had the ackee and chicken back like that, mix up. No, but I've had it before. 2 separate meals. But my mom never cook ackee and chicken back like that. But I love chicken back because I love the bone. Especially when it curry down nice. Yeah man, I love a good chicken back. Welcome everyone. I don't know if you love chicken back too. Curry goat is my favorite. Girl, I think that's what I'm marked for. I think I have a goat on my leg, on my thigh. My birthmark is looking like a goat. Alright, so I think my mother, at the time when she was pregnant, we always have something about them little stuff there. When she was pregnant, I think she was scratching her leg because she wanted a goat. So I think that's it. So I love curry goat as well. But, most of the time you go down, you can't really get any curry goat to eat. Or you have to tell people, go ahead and prep the goat from before. Yeah, but I love curry goat. I love a good curry goat. I find chicken back at the Asians. Maybe I find chicken back at the Asian supermarket. My mom is here, so guess what? We can actually buy the chicken thighs and she cut it a certain way so you can get the chicken back. And then she'll curry it. You understand? But, yeah. I remember when we were coming from primary school. In primary school, we used to have this lady in Prattville named Miss Ina shop. Every day, would be buying $5 or $10 worth of chicken back. How matters? Lord. It wasn't much, It wasn't much because you would find out some persons will get the chicken bottom. The buttocks? Come to think of it. I remember that we were very, very young and we'd be buying chicken back. I said, no, sir. Looking at it, no. Like, yeah. It's a tail. Fried chicken back and sky juice every single evening. Kids would be buying it. I wouldn't be buying it, but I would be eating because my friend would give me a piece. But, like, I remember, yeah, we used to buy fried chicken back. I was shook. I used to buy whole chicken. When you used to buy whole chicken, you did rich. We used to raise chicken, We raise chicken. We have our own chicken coop. Yeah, so we did that. But most of the time, like on Sundays, you'd eat chicken. You'd eat the chicken. Other time, you probably eat chicken back. You eat chicken back during the week or saltfish or whatever it is. Whatever it is that they cook. But yeah, I love a good ackee and saltfish and dumpling. Walmart cut the chicken bad sometimes. Well, I don't really know how the chicken's supposed to cut Renee. So as you know, I'm very, very simple. So however them cut it, I just want to cut it up because it's either I'm currying it or I'm brown stew in it. Or I just go ahead and just put it in the oven. Get a steak. What's that? Oh, the chicken back? You're talking about the chicken back? Ajay? Yeah, so that's just it. Yeah, that's just it. But I miss those kind of food. I miss it. Because I'm kind of tired of chicken now. I'm kind of sick and tired of chicken. I'm not lie. And then the oxtail, I don't know if it's kangaroo tail or I don't know what kind of tail it is. But I'm sick and tired of chicken. And then I can't find any decent fish. You understand? I'm sick and tired of the American food. And I'm not complaining if you're from America here and you're watching this video. Alright? I'm not complaining about the food. I understand the opportunities here and I took it and I come here and I'm supposed to be cultured and enjoying food and everything. I'm just kind of tired of it. I'm tired of eating the same thing. They dispose it back most times. So when one curry, I buy chicken is not the same as Jamaica. No, sir. So Stacey, I tell you, when I just come up here, sometimes your parents cooking, and when they're cooking, so for example, I cook beef. The beef, the beef on top of the fire for about 5 hours. For the whole Sunday, them cook beef. To the point where sometimes they probably put a piece of metal in the beef because them just say the beef tough. When I come up here the first time I was cooking beef, in about 15 minutes beef done cook. The beef soft, mash out in the pot. I mean, I said, what kind of beef this here? What kind of beef this? It's the same thing for the chicken. Before you know it, the chicken done cook. Asian supermarket just, you see nice snapper, but it's $14 a pound. Which Asian supermarket? I'm going to find out because I need the actual real snapper. I need a real snapper to eat. I need a snapper with head to eat right about now. Yeah, chicken is not the same. No, it's Ranch 99. No, it's not the same as Jamaican food, may I tell you. It's different. It is so different. It is so different. We went this morning and fry and clean. We went the fry and clean it. Them fry it or them clean it. I don't want them fry it. Me fry it. I'm probably gonna go over there and look at it. If you want it fried. Oh, okay, okay. Okay, that not sound bad. I'm going to go over there and look and see. But I really need a I really need some real fish. I'm tired of the fish them, man. Just avoid the weekend if you can. Okay. Okay. Now look at it and see. But I need something like, I need something different. I'm tired of the freshwater fish. I'm tired of the salmon. You understand? Oh, it's back on the weekend. I'm tired of it. So I go to a lot of times, as I say, a lot of times I eat dumpling. I love dumpling. Dumpling, sometimes I can't find even a piece of yam. Can't even find a piece of yam. I got a yellow yam the other day. I mean, I tell you, I go back down there to try to see if them have more yam. And them not have more yam down at the place. You understand? But I'm sick and tired of the same thing over and over. As long as your fiesta, that's where I got the yam. As long as I can find the Jamaican food or things that I can cook that is similar to my Jamaican diet, I'm gonna try and find it, because anything else, I'm not enjoying it at all. Yes, everything is so expensive. Definitely. I saw somebody put up, I love ackee, and I saw somebody put up where they have ackee going for $18 or $19 a tin. Linstead ackee, the best one on the market, and it was at a discounted price. And I'm like, what is going on? The last time I saw it, I think it was like $15. Yeah, I think it was like $15 in Fiesta. But I haven't seen any for a long time. So when someone posted it, this young lady in New Jersey, she posted it that she's in a store and it was going for, I think it was $18. Oh, it was on her status. I think it was like $18 or $19. I mean, I say $19 for one tin of ackee. And when you open up one tin of ackee and you cook it, I want tin for me that, because it's not enough ackee in the tin. You understand? It's not a lot of ackee in it. So it's not even worth the price. But ackee still have to eat and fried dumplings still have to eat. You can't stay here. No, Stacy. I need fried dumpling. So I love my ackee and saltfish and fried dumplings. So I'll end up and buy 1 or 2 tin. Yeah. But usually when I go down though, when I go down to Jamaica, I always tell people that my suitcase when I'm coming up, it always have like tons of things, like food from Jamaica. Because before the year, like if I know that I'm going down, if it is pumpkin time, I have my relatives cook the pumpkin, mash it out, put them in some little small bag, just like how you have sky juice. Yeah, man, and freeze them. So let me tell you some trick. So let them go ahead and just freeze them. Mash out the pumpkin, cook the pumpkin, mash it out, and put them in the small little bags and freeze it. So every time I'm ready to cook my soup, I just get one of those and I just thaw it out overnight and then I cook. So my suitcase always have a ton of frozen food. 1 year was coming up, never really did need chocho like that. I don't know what to call it, but I call it chocho. What is the other name for chocho, Renee? I don't remember the name for chocho. I go in Walmart and see it, but I chocho me know it buy. You understand? You don't know it. But you know, chocho in a soup tastes good. So I was coming up and it was chocho season. So it was the same thing. Cut up the chocho, the green chocho, and put it in bags, small parcels, and bring it up. Alright, some of them they end up on a tower before. And even though I cut up, I try to tell them, say, look, this can't grow. Them still take it and throw it away because it was green. I say, okay, that's fine. A chocho. I can get it in Walmart. What else I do? So I do my peppermint. I have them wash the peppermint, dry it. And then when we go down, we put them in a bottle and bring it up. Or brown paper and bring it up. It's the same thing with rosemary. June plum. You miss eating June plum. I got to tell you a trick about June plum. One day I was coming up with a June plum, some June plum, but I put it in some socks. But the person was pregnant. The person was pregnant, you know, and they wanted a June plum. So I decided that I'm going to bring the two little June plum. The June plum was so tiny because it was the end of year, you know, or end of season for June plum. So the June plum were this tiny. And they wrap it up in the socks. I know that, you know, they're going to pick it up. Because they pick up everything. And they wrap it in a socks and put it in the suitcase. Some put it in each section of the suitcase and put one in one shoes. And the people them, well, it was a dog. The dog come over and stand up beside me and just slide up beside me. So me the damn I dead with laugh. Come here and say, what's up with this dog now? It's either one of two things. It's either the June plum or it was the fish. Cause I come up with fish, and I come up with jerk chicken, I come up with roast breadfruit. Yes, the dog come and lie down beside me. So you know me looking like, okay, just I look at the dog and I laugh. Come here and say, what is it that you want now? Why you decide to come over here beside me? So anyways, you know, I got pulled over and I went and I went through. And the people them now start open up everything because me have a escovitch, me have Scotch bonnet in a vinegar with I have Scotch bonnet with vinegar and I have it with onion in a some bottle. Let me tell you them it's strong, it's strong. When the lady opened it like this, she's like, wow, what's that? I'm like, it's escovitch. She's like, wow, because in it I have a lot of seed. So the pepper seed was in it. So she's like, what are you gonna do with this? Do with this? I said, I'm gonna fry fish and put it on it. She's like, oh. She said, but there's seed there. I said, yeah, but they can't grow. I said, I can't grow, ma'am. I can't grow. So anyway, she closed it back. And I thought she was gonna throw it away. She never threw it away. She put it back in the bag. I said, okay then. She go now and she open up the breadfruit. So you know the breadfruit black. Because it still have everything on it. Because the breadfruit was last minute. So usually I get it peeled and cut up. But it was like black. It full of pear, like charcoal. And she was like, what's this? I mean, I already done cut the breadfruit in two. So I said, it's breadfruit. And she said, what are you doing with this? I have to explain to her. I say, it's to eat with the fish. So if you dash away anything else, I'm not going to enjoy it. So she lock it back up, cover it up. Then she opened up and she said, what's this? So I said, ackee. So she said, all of these are ackee because now I have small parcels of ackee that already they cook and have oil and everything on it. So she said, what is this? Someone said, ackee. I never hear about ackee and saltfish yet. I said, sorry, but this is the, you know, the best of it. So it was already frozen for how many months? So it was in my suitcase. Then she go down and she said, what is this? Someone said peppermint. But the peppermint, no, the peppermint never dried properly because some of the peppermint was last minute. Some of the peppermint was last minute and the rosemary was last minute. But the thing about it is that even though the rosemary was last minute, it was a little bit darker. It did kind of dark. I mean, I said because it was in a plastic bag. So I never remember to bore any hole in the plastic bag. So that was it. So she said, oh, somebody said, but this can't grow. I said, it can't grow, ma'am. It's like, you know, it's dead. Like it's damaged. You can't grow anything. She's like, oh, but it's still green. I think it's still green. So I said, I beg you, please. I'm begging you, please, do not. So anyways, as soon as I reach in the car, so I just take out the pepper, the rosemary out of the bag. And put it with some water. So that way it could actually still stay fresh and then we go home and dry it. You understand? I know they worry about it. I know they worry about it. Everything they worry about is in the bag. When me tell her, she dig up everything. She take my fish now and she was about to smell it. I said, no dear, do not smell it. Do not smell the fish, it's fish. Like, what else could you be smelling for? You understand? It's fish. So she's like, what kind of fish are these? I said, parrot fish, escovitch fish. Like, she wants to smell me fish. And I said, well, let me take that back. She wants to smell the parrot. You understand? So I said, no, lady, no, please do not. You understand? And she put it back. But she was like so excited about the bunch of things. But when I tell you, my suitcase always have a ton of things to put in my fridge. Even yam. I cut up yam in pieces. Cut it up in pieces. Yes, it's probably too soft, but when you can't find any yam in up here, what you can do? What you gonna do? Me cut up my yam. It don't cook, but they cut up in small pieces, and then I bring it over. Put little water in there and freeze them and bring it over. And when it's time for me to cook my soup, at least me have yam, me have pumpkin. Can go in my soup and me have a bag of cock soup them that I can use and make my soup. Because honestly, it's depressing if I can't taste it or smell, the pumpkin in the soup. Because one time I did buy a squash, them call it. Never really used squash before, but I went in to buy the pumpkin. And first they were telling me about the Halloween pumpkin. But the pumpkin, it just looked too good for me if you use at the pumpkin day. Yeah, it is too orange. Some say, no, I don't want a pumpkin there. You understand? I say, you can use mixed soup. I say, no, I don't want it. I don't want that one. So I don't really eat any pumpkin. And then they tell me about the squash. I'm going to go buy the squash. I don't know if the squash was green or so it's supposed to be. But the squash ended up making the pot sour. Yeah, it have a sour taste and it's like a bunch of froth and all of those things. So I never really enjoy it. I just tried tasting it, but it was like a total waste. So what I did was strain off the water off of it and then pour hot water on it because I couldn't make my soup go down the drain like that. And then I put some more hot water in it, get one of my small pumpkin bag, and then drop it back into the pot. Because I already done put in my dumpling and chicken foot and everything in the soup. So I did already done that. So I can't make the squash spoil my soup. So I had to go ahead and strain off everything now. And then add hot water to it. Add pumpkin to it and throw 2 cock soup in it to make it back to a soup. You understand? And that was it. But now the squash thing now work out in my favor. You understand? So I just look past the squash. It's too green. I don't know if it's too green in a DRS, but I was trying it and it never worked out. So that was the end of squash for me. Yeah. So the other day when I went and I got a piece of pumpkin from the same Fiesta, I tried it and it cooked real good. And so what I did was go back to the store and get the remainder, the pumpkin on the shelf and put it on my fridge. Because at least I feel as though it's a real pumpkin. But otherwise, me can't really find the pumpkin them. Can't find the pumpkin them to make the soup. Or else it's just gonna be not gonna taste good. Not gonna taste good at all. Yeah. But apart from that, that's just how me, that's just how I do it. Sometimes I'll go little Ochi and buy the fish. So at least, even if fish are tiny, at least I can still be eating 1 or 2 little fish every now and again. Just fry them and put them in the bag. Fry them and put them in my bag and just bring them up until I know how to pick them out. Oh, the pumpkin. Okay. Yeah. So that's just it. So I try to do all of those things when I go down. Bring them up in my suitcase. Me always I go through a problem, with, but a lot of times the things come through. It was only the June plum that, the dog did smell. And and they take away the June plum. Well, they never really take it away. She gave it back to me because I tell her, I say, you're going to make the lady get marked? You're going to make the lady baby get marked for June plum? I say, it's only 3 June plum. She said, but, I say, yeah, but. I say, if you know Jamaicans and, when they need something, when you're pregnant and if you, she said, the baby is going to get marked. And I say, yeah, the people are going to get marked for June plum. Because the lady has slung away on the June plum from when? You understand? It's 3 tiny June plum. And she said, okay then. I said, the American grow. I said, because she's going to go ahead and she's going to bite up the June plum. She said, so what about the seed? I said, she's going to bite that too and chew it up. You understand? Because the June plum young. I would cry that the June plum. The June plum were so tiny. They weren't like big June plum. So I think probably even if you cut the June plum seed, it cut straight through it. Because it was so tiny. They were so young. You understand? But this girl, she was just singing on June Plum for the entire pregnancy. So me bring her June Plum. I could only get the 3 June Plum and bring it to her. So to come all the way up here and then now to find out that, you know, the June Plum not going to reach to her in New York. A problem. You're not making the lady believe in curse. No, sir. No, I'm just trying to get the June Plum across the border. Oh, goodness. But, you know, that's how I try to do. One year, I don't know how they never get the pepper seed. I had a few pepper seed because that's how I could get the real pepper. This real pepper. So I have a bottle with like a Scotch bonnet pepper that I had my parents dry. Yeah, so you know the Scotch bonnet. So I had them dry it and I take 1 and 2 seed every now and again and drop it in my pot. When you drop 2 seed of pepper in your pot, you know, depending on how hot the pepper is, you know, it will burn up your mouth, you know. Yeah, man, it's so spicy. It is so spicy because it's a yellow, you know, the Scotch bonnet, the yellow Scotch bonnet pepper. So I only need like two seed and I take it and drop it in there. I was kind of surprised how it ended up, you know, coming through. I guess probably because it was in a bottle. I don't know. It was in a bottle. But it was only pepper seed in the bottle. One of those Mrs. Dash bottle. Yeah, so the entire pepper seed come up here. So I still have pepper seed I use to date. And that has been a long time now because, as I say, it's very spicy. If you let 5 get out in the pot, you can't eat the food. You understand? So, but otherwise, those are just the things that I walk with. I let them dry things in advance, and whatever can mash, get mashed out, and whatever, or crush, or whatever can get cut up, and put up in the bags, and I'll freeze them and take them on my merry way to the States here. And feel like a Jamaican girl for the next couple of weeks eating Jamaican food. Yeah. Oh, welcome everyone to the live. What's Barra? What's Barra? What's Barra, Renee? What's Barra? You said Barra is your favorite. I think probably, are you talking about, who this year? Hi, cuz Blue Tick 876. Who this? Hi, Blue Tick 876. How are you doing? You say hi, cuz. Oh, that's me can look up. You say hi, cuz I don't know who this is. Barracuda fish. Well, you know, you explore a lot of things when it comes on to food, you know. I don't think I've tried that before. I don't think I've tried that. Blue Tick. Where I know you're from? Let me see. Blue Tick. Blue Tick 876. Are we friends? Let me see. Let me make sure somebody are friend first. Blue Tick 876. Jamaica. I only get those from I only eat the salmon and the snapper. Okay. Yeah. Okay, so Blue Tick 876. I mean, I know you cause gonna try to slice tuna one of these days. Okay. Yeah, I don't know you cause alright. 876 Blue Tick. But welcome, thank you for tuning in. Alright. Windmill therapy. So what you doing now? What kind of braid you putting in now, Renee? Are you doing your natural hair? Knotless. Okay. I got a knotless. Is it the same lady that that you had sent me to at one point? Yeah, okay. I did like the necklace, but them have too much person on me here at once, man. I couldn't do that. I can't bother with it. That was just the problem. And the lady put the comb in her hair here and then put it in my hair. Or attempted to put it in my hair. I never liked that. So I haven't been back to them since. Try moving fast. Oh yeah. Yeah, they have too much purses in the hair and it was just too much for me at the time. And then no one was pregnant. There was one person that was pregnant. There was one person that was pregnant. I've never had like somebody that is pregnant in my hair before. So my auntie years ago when I was a child, that was it. But apart from that, no pregnant person hand in my hair. Yeah, we grew up with my granny as well. So, you know, we have a lot of things that we say in Jamaica. You know, probably if you're pregnant and you're doing somebody's hair, then them hand will drop off your hair, stuff like those. Yeah. Or if you have, if somebody is hungry and they want something to eat and them scratch them skin and they're pregnant, the baby is going to be marked for that, meaning the baby is going to want to, the baby gonna love either fish or pork, whatever it is that, you know, you wanted at the time. Or you'll get the mark. The child will have the mark at the site that they were scratching. So you'll hear a lot of parents be like, oh yeah, at the time I wanted jackfruit. That's how you ended up with that jackfruit on your leg or on your thigh, you know, the goat, things like that. Something wrong with that? I never know that. Yes, that's what they say. So from them long time, that was the last person that, you know, did my hair was my aunt. And after that, there was no more pregnant, you know, women handing my hair. So that was just it. So we have our little saying. All right. What time is it? 1:36. The more you know. Yeah. But I just never like having so many purses in my hair at the time. Because I had probably like about 6 persons. 6 persons I do the hair. One I do the front, one I do the side, one over here. So 2 I do run a back. Yeah, that's just too much. That's just too much. Yeah, it was just too much. And then the one lady, she had her comb. She had the comb in her, you know, sticking her hair like this. So me just watch her, you know, because me I say I could never my hair. She gonna use a comb there now, because she was ready to go through the hair. And then she should go something like this now. And I said, dearest, no. I said, no, dear. I said, you're going to have to find a different comb. I said, that's your comb now, all right? So you're going to have to find a different one for me. But we're not going to be mixing, you know, we're not going to mixing anything. And the comb not going to be mixing between my hair and your hair. So she never really liked it. And because I told her she's going to have to wash the comb or she's going to get another comb. You understand? But we're not going to have her in my hair using that comb. And she called the boss and tell the boss that I'm a difficult client. Yeah, difficult client. So I say, so the boss came and she's like, what's happening? So I said, oh, she never tell you the whole story. She have the comb in her hair and she take it out and put it on my hair. So she's saying that I'm a difficult client. Like, no, dear. No, that's a dirty comb. Like, I cannot do it. I don't know if she have dandruff in her hair. I don't know if she have lice. I don't know what is it that she have in her hair. But I'm not going to have her use the same comb in her hair. You understand? And then put it in my hair. I said, no, we're not mixing things like that. So she's like, oh, no, that's not supposed to be happening. You're supposed to put the comb. I'm like, yeah. She's supposed to put it in the little water over there. Let it soak. And then, because she was telling me that I can bring my own comb. So she wrote, she said, you can bring your own comb too. So I said, yeah, I have it in my bag. You understand? But I just saw everybody with them comb. I just thought that, you know, because I normally walk with my own things when I'm going to the hairdresser, I come in on my hair thick. So I said, I have my comb here, but I never know that, you know, we're in the practice of using the same comb in your hair, in my hair. I said, no. So she told her, so I said, after this, I'm not come back. So she never finished, she never completed my hair. And I was like, that's fine. That's fine. I said, that's okay. I'm just not coming back. Just not coming back, so I never go back. But the hairstyle was good. The person who did it was good. Yeah. So blue tick is asking. 99% is mine, blue tick. So yeah. So I put in a little extra to keep it together. Alright, so it lasts a little bit longer. So I don't know if you see that it is a little bit fuzzy. So 99% is mine and 1% is from AMAZON. Alright, it's the expression braid. Because yesterday, I think I got dinged. Not yesterday, the day before, I had a book I was showing. So there's somebody on TikTok here that has a book that they wrote. And I was showing it to persons to say you can go ahead and buy it. It's something that, you know, is worth reading. It's about their daughter who passed away from rhabdomyosarcoma. So the daughter was around 7 at the time when she passed, but she was diagnosed around 4 years old. So they wrote a book in remembrance of her. And I was telling persons, go ahead and just purchase it because they were on my live and they said that they weren't getting any they weren't getting any, you know, sale on the items. So I said, okay, then 3 persons ended up buying it. So I was just kind of telling persons because we had a few persons on the live. And I got a little thing on the app here to say that basically me I violate. I don't know what I was violating. So basically I can't promote. It was something regarding promotion. I cannot promote anything. I guess if it's not from TikTok, you can't promote it. So I was like, oh, I didn't even realize that because all this time I keep on showing persons, oh, this is the braid. This is the braid that I'm using. So persons can know that, you know, this is what I have in. But apparently I can't do that. So yeah. Thank you for the follow, Royce Trotman. Oh, you like it, blue tick? Thank you. Yeah, I'm more of a... Not a problem, AJ. Thank you so much for tuning in. All right, hope you get your phone back soon. Thank you for the follow, blue tick. Yeah, I like to have my hair natural like this. Yeah, I'm not really the Remy kind of girl. No, it's either this or probably will have, you know, center part. And probably one plait over here, one plait over here. You know them long time hairstyle there? Or this. I can't catch it up because it's a lot. So I can't put it in a pony style. What else? Yeah. Or I'll do the faux locks. Because it's a protective style. So those are just the 3 hairstyle you probably see me in. Alright. So this minute you probably see like 10 plaits. And they just, you know, fix up neatly. And then I put on my little makeup, fix up my eyebrow, and I'm good to go. I'm not really, you know, I'm not that hard to deal with. I'm not a difficult person. Hi, Lashana. Thank you for following. Marlene Brown, welcome. And remember, you can go ahead and follow me on or subscribe on, cannot even say it either, too big. But subscribe or follow me on YT. All right. It's the same ThinkNursing. My full live are over there, and longer form contents are over there. So I talk a lot about nursing, travel, lifestyle, my background, things like that. I wanted to try the silk press, but tried book appointment late. Oh, you know that I did the silk press when I just moved here to Texas, just because I feel like, say, I wanted a different look, and the girl messed up the hair. Yeah, so there was this, when I just moved here, I was in Maine and I was like, oh, I'm kind of tired of the twist out and all of those hairstyles. So I wanted something different. And I thought I could rock the silk press. And I went to this place in Dallas, because online they had really good ratings and, you know, they seem to do a good job. When you look online, the photos were good, the videos were good. I mean, I tell you, say, I couldn't wait to come to Texas. And I went to the store and I booked the appointment. I called and I booked the appointment, went over there. And so I did the wash. But I know that it was going to be it was a mistake, you know, because people can't really manage my hair. But anyways, I went and I washed it and we blow dry it. and then she tried to do the silk press. After she did the silk press, I think I have a video of it, you know, not a video, a picture of it, you know. She did the silk press, but the silk press, after me done with it, Mr. Torres say, why your silk press look like when I dry my hair? Like when I use the dryer and dry it out properly and straighten it in a sense, that's how the silk press kind of look. You know, sometimes you're probably using the blow dryer for too long and it just kind of thin out some part of your hair and then you kind of see some section that just look natural. So I was saying to her, I don't like it. I don't like it. So she said she could actually go through it again because you know them already turn you. You're not facing the direction of the mirror, so I couldn't really see exactly what was going on, but I could actually feel, you know, it felt good. So when she finished, it's like I could feel like some of my hair itself never feel good at all. I mean, I said to her, I thought it was gonna be like, you know, looking more like a perm. That's the look I was looking, because them time I'm ready to do up my bob hairstyle, you know, because I don't know, you probably see that most of my videos are like this because I love the bob hairstyle. Not because my forehead big or my head big, but I just think if I'm supposed to perm my hair, the bob hairstyle is what I'm going for. A bob you call it, you know? So you put the part here, the little part here, and then this side is longer and this side is shorter. That's the hairstyle I'm going for, and that's it. That's the only thing I'll be wearing. All right. So she did it. So when me done, after I was finished, I was like, okay. I look in the mirror and me and say, but this not look good. It not look good. It wasn't to my liking. And she's like, yeah, it looks nice. I say, yeah, because you do it. You understand? It look nice because you did it. But to me, I'm not enjoying, this is not what I envisioned for my first silk press. And let's see if I can find it. This is not what I envisioned for my first silk press. So she said she could actually go and do it again. So I said, no dear, you're not going to do it again because you're going to damage my hair. But then when I was like trying to run my hand through it like this, it's like a pure, you know, hair coming off in my hand. I mean, I said, this don't make no sense. Like, I really understand why, you know, the hair break off like this. Like I was doing this and it's like just hair coming off in my hand. I mean, I said, this don't make no sense. But anyways, you know, I thought it was because it was the first time I doing the press. It was like that. And I tell us, so by the time I reach home, my hairstyle, my bob hairstyle, because I did the part here and, you know, as I said, I have a lot of hair. The hair was just up so. It was just so much. I mean, I said, no, it's supposed to be flatter than this. It's supposed to be flatter than this and look nicer. So I just go and wash it out and call her and tell her, I said, this don't make no sense. It never made no sense. Where is it? It never made no sense. Oh, for goodness. I'm trying to find it. So she said that I could come back in and do it another time. I said, no, sir. Nope, nope, nope. But it never do good. I'll stick to, as I say, you know, your hair is mixed, you know, Renee. You have mixed hair, so it probably, you know, come out better for you. But my hair is very coarse. My hair is very coarse, so it's harder to deal with. But yours is already thin, so probably it will work for you. Hi, Ziggian. Hi. Yes, thank you for tuning in. Yes, ma'am, you are mixed. You have quality. You have quality here. You can just wash and go. I can wash and go. If I wash and go, I never go cut it off. You understand? So your wash and go is gonna give you curls. I saw no one wanna know now have good hairstyle and have quality hair, you know. So no one about good. Good. Yes, so no behave. Let me find a little hairstyle. Alright, so when I get home, so my son was 8 months old. This was my little thing there. Yeah, so this was my flat iron, my silk press. That was my silk press. I said, no, sir. Not at all. That is not what I envisioned. I think I had that's my silk press that I had. I think there was another. I have another one. But me say no, sir. That not work out. Not working out at all. So I just go and wet it up, and then dry it, and let the flat iron go. Yeah, but let's say you probably have a different experience, and it depends on where you go. But then again, it turned out, because when I call them and I tell them that I need a refund because this don't make no sense. I say I'm not supposed to be having this, and I'm not supposed to be breaking so much hair. Because I was asking them if they use the steam, you know, not the steam. You're supposed to use something to protect the hair, you know. And I asked them if they use it. And she said, yes, she uses it. So I said, so why is so much hair come out in my hand? You understand? Obviously something never go right. So they say that they can't give me a refund, but what they can do is they can give me another one. I said, no, it's all right. It's okay. I never wanted anymore. So it was at that time I say, yeah, this Remy thing and this flat iron thing. I said, this is the hairstyle for me. There's no other hairstyle for me. I sell Batana oil. Luminous, Batana oil or Botanics? Is it Botanics? How are you doing? 100% Batana. I bought some online the other day. I haven't used it as yet. They were doing like, I think they had a deal for 2 buy 2 get 2, something like that. But you know, so for some strange reason, I guess probably because I'm not, when it comes on to trying out different things, I'm kind of very hesitant. So I bought it. Yes, the castor oil is still good. I still use my castor oil in my hair, mademoiselle. Thank you so much for producing it. Yes, man. I'm not using too much though. That's what I'm using tonight on my roots. I'm not using too much though. I just use a small amount mixed up with everything else and straighten my hair. Yeah, thank you. So, luminous. So, Batana. So it's so you say your you have your own your own Botanics. Batana. I mix up the thing. Some are fake. I have the 100%. Okay. Yeah, because I see some people saying that, like this girl, and so comes to tell us saying the internet is something else, you know, because this girl, the side of her hair is as nothing is there. It's like my forehead, right at the side here. And she said that she used it. I didn't purchase it based on that though. All right, I was looking at the ingredients in the bottle, and that's what I used to purchase it. So she says that she has no hair at the side, right? I want me to say she have alopecia, and the sides of her head is looking like my forehead. And in 2 weeks, she said that she have like growth, like this amount of growth at the side. I said, no, son, not easy at all. No problem, Renee. I said, no. That don't make no sense. I don't think it's like that. But I ended up buying it because of the products, because of the natural products that were in it. Luminous Batana oil. Hold on there. Let me look it up. So I have 4 bottles that four bottles that I haven't tried as yet, because I'm pretty old school, let's just say. I stick with things that I know work with me. I've been using most of these products from back then, from Mia Domini. Yeah, so the some of this, if you're from Jamaica, some of the same products that I buy in like the Chinaman shop in Jamaica, it's the same products. I see them in Walmart, and because I don't have no problem with them, I continue using them. All right, I continue using them. You have to make sure it's the pure one. Luminous. I try Google your let me see how Luminous Batana oil. So is the brand Luminous Batana oil? That's a brand, right? Luminous? You have to make sure it's a pure one. I don't have a page for it. Okay, okay. Yeah, as we say, as long as it's natural, if I know, okay. If I know that the product is natural and no salt not in there, no mix up and all them stuff there, just like the castor oil I get it from, like when I go to Jamaica I get my own castor oil, or my parents will normally get the castor oil and I'll bring it up. But then I have a friend who has natural hair as well, and her hair is thick, so I got some from her because mine was finished. But apart from that, if it's not something that, like if I know the person selling it, then I'll get it. If not, then I not use none. You understand? Because a lot of times the castor oil, they don't do it properly. There's a young lady on YT as well, Rochelin, Rochelin, I think. She has the castor oil as well. So if you're interested, you can always check out her page, Rochelin. She has castor oil as well. But majority of the time, you know, my castor oil, I know the person, or my parents know the person, things like those, and then I'll get it. But I don't really use too much in my hair in terms of other products. I'll use like the peppermint, tea tree oil, ginseng oil, avocado oil, grapeseed oil. I'll use coconut oil and the castor oil. All right, I'll use those in my hair. Mix it up together, and use it on my scalp and everything. So yeah, but aside from that, as I say, I don't really try out a lot of products in my hair, just because I'm just scared of it, and because I haven't had any issues with the ones that I've been using, I just stick to it. All right, so once it is something that has been good for me, no issues, no problem with it, I'll just continue working with it, and that's just me. All right, because probably you're asking like what shampoo I'm using. My shampoo is the same like a Cantu shampoo. It's the same Cantu shampoo. It's not no fancy shampoo with no name, like, you know, a big name. I know Cantu is like a big brand, but it's not any... what are the names of the shampoo out there now? Tresemme and... I saw Tresemme. I don't even know because I'm not look on them stuff there when I go in the store. I don't look on it. I just look for my Cantu. And I get my leave-in conditioner. I get my Cantu shampoo, conditioner, and that's it. I don't look at anything else. So if you ask me what else, you know, you could try, I couldn't tell you there. I couldn't tell you. And it's the same thing for the hair oil. Apart from those that I tell you, if you go into Walmart, then I might just get one of those. The same thing within a Chinaman shop at Jamaica. What I call it, bergamot, or there's another one. So you have them in green, blue. I don't remember the name of it, but the white one. I just know that I know what the bottle looks like, and I just go and grab it, and that's it. And when I wash my hair, I put it on my scalp, and that's it. And then throughout the week, I will use my mix up with my castor oil and spray it in my scalp, and that's it. But I'm not using any fancy nothing on it. So that's just it. Where's my wrist hurting me? So how are you guys doing? So Luminous, how are you doing? I know I texted you this morning. Are you working or are you taking some day off? Brittany Shakes, welcome. Shanae Campbell, Nisha. Thank you for the follow. I don't know who this is. At work, no, because gonna need the time to go funeral. Okay, totally understand. All right, well, I'm here. I'm here. If you need anything, you can always reach out. All right. I'm here. Mona Lisa, thank you for joining. Yeah. AK, welcome. Thank you. No problem. No problem, Luminous. Not a problem. Abraham, how are you? It's not Dr. Abraham, this. I doubt it. I remember Dr. Abraham. I don't know if you know Dr. Abraham in Jamaica, who is a gynecologist, but he's also an actor, comedian. And I tell you, I was a nursing student at the time, and I remember going up to this hospital, this private hospital that he works at in Mandeville, not in Mandeville, in Kingston. And I was seeing the patients at the time. And I saw this doctor in the room with a patient, and he was just having a good time. I mean, I said, what? Like, in my mind, I said, what a joke I do here. Like, I never know that the man was a doctor. Because he's so funny. You understand? He's a comedian. He's like so funny. I saw him on the bed sitting and the patient was there. And I said, what is going on here? Everybody was just laughing. The patient and the relative was laughing and the doctor was laughing. Then after, you know, I went around to the nurse's station. I see the gentleman, because, you know, a lot of times some of the providers, they don't really wear like scrubs or jacket and tie and all of those things. He was just like in a jeans and a t-shirt. And I was like, okay, then. I was about to say, you're not supposed to be in this section, you know. But then nurses and everybody was like just having a good time, you know, having a conversation with him. He went and he sat down and he was like on the computer. I mean, this is just so weird. You know, this comedian is sitting here. He's going through, you know, on the computer now. Who is he? And it was at that time I realized that this gentleman was like a big OB-GYN. You know, he had like majority of the patients on the floor. They were like, yeah, that's Dr. Abraham. So I'm like, oh, okay. I didn't know he was like a medical doctor. You know, I just know him as a big comedian on TV. You know, so funny. But we had a wonderful chat the day at the nurse's station. It was nice. But yeah, I was like, Not a problem, Luminous. Not a problem. Ellie Cam, welcome. Maxine, welcome. All right. And remember to go ahead and follow me, people. People. Go ahead and follow me. All right. Follow me here. Oh, I should ask. Oh, I probably should have asked earlier when there were a few more persons, but I can pass the word around. If you know anybody that is in the Mandeville area, is Mandeville Christiana side. All right. If you're a nurse or if you know a nurse who wants a little side gig, I have a friend who has her dad got discharged from the hospital yesterday or the day before, and he has a NG tube, so she needs assistance with getting him a nurse to come in. I don't know how many days per week, but you'd have to speak with her regarding that. So if you know anybody in that area, she's looking for a nurse, all right, to help out with the feeding and checking in on them, because, you know, she's not there anymore, so she just needs somebody to help her with that aspect of their care. All right, in that area of Mandeville. It's Mandeville's, yeah, that cold section, Spalding side. All right, so if you know anybody, you can always send me a message and I will try to have her reach out to them. All right. Oh, it's 2 o'clock. I need to go and pick up my son. So, all right, I am gonna jump off the live and then we will chat later. All right, we will have another chit chat later on. I'm trying to do my live stream later on for exercise. I'll try to come back in time and see if I can do it. I think probably on Fridays I might end up doing the live stream for my Peloton ride probably in the morning, depending on how the Friday evening go. You understand? Because you know, sometimes, you know, you're my Seventh Day Adventist, alright? So, you know, you have some people, then we see I do the live, and probably sunset, and then them complain. So, you know them way there? You know them way there? Wink, wink. So, I probably end up not doing the live on the Friday evening. If you tell you, Stacy. So, I probably not do the live on a Friday evening like that. Just because I say initially it was 5:30. And I don't want it to be a case where I'm doing 5:30 until 6:30. Sun usually set around 6 o'clock thereabout. So, you know, we still observe the Sabbath as much as we possibly can. Alright, so I try not to do a live stream at that time. Unless I'm probably going to play the church. You know, probably going to play some music or something. I don't want to come and preach. Because I can't preach, you know, I'm a nurse. I can't preach. So unless you want to come and preach, then that's different. We can do a live stream and listen to some music. Sometimes I'll play some music, some gospel music. Nothing is wrong with winding down the weekend, you know, or the week with some gospel music. So depending on what's going on. Yeah, listen to some music and just listen to it together. All right. But I'm going to go and pick up my son now. So I will talk with you guys later on, or probably on Monday or Sunday or Saturday. Yeah. Where's your ring? I have it. I have it. What's up with your what's up with my ring? Kev? Where are you joining in from, Kev? Because this is the first comment I'm seeing from you. Eh? So how you do wear it? I have a piece of it on. I have a piece of it on. I'm a very simple person, you know. So this works perfectly fine for me, especially when I'm putting on my glove and all them stuff. They're not saying that I have a bling or anything like that. No, my ring is very simple. Alright, as I say, I'm a very simple person. I think this is like elegant, you know. Yeah. So that's my ring. Alright. Okay, thank you for tuning in. Remember to go ahead and follow so you can continue to see the ring. May I mix up, not true? But go ahead and continue following. All right, make sure you follow the page, and you can watch the content, and you can bring your friends over, send it to your family members, and let them watch it. And if they're a YT person, they can also subscribe to my page and watch the video as well. All right. So Kev, you're looking for a wife? I'm gonna hear a little bit more mix up before we go. I'll give you about 5 more minutes. I'm gonna watch there. In Kev? Because they just come onto my page and say, where is my ring? Eh? Where is Kev? Kev, mix up. All right then. Well, guys, I will see you guys in another live. All right. I will definitely see you in another live. I'm going to go get my son, and then from there, I'm gone. I'm if I tell you, once I'm coming and say you're not available, you know, them gone. You understand? I probably still watching the live, you know. Probably still watching the live. Yeah, I have another friend who is looking. So if you're a nurse and you live over the water, you understand, he's in Jamaica, but he wants somebody over the water. You understand? He said, I want to go on the plane. So I guess anywhere that is not in Jamaica. But me tell him, said his wife might just under him nose, and him don't realize, if he's so focused on getting somebody that he have to go on a plane, to get, him probably have the wife right under him nose and him don't realize. You understand? But anyways, him say him want a nurse, and him want one that him have to take a plane. Him have to take a plane to go and see. You understand? Him want a wife across the, the seas. So if you're a nurse and you're looking for a Jamaican man, alright, if you're looking for a Jamaican man, it's not a dating show, but he came on, him tell me, so I put him up on the screen. So I put him up. You understand? He was like, put me up on the screen. So I'm like, okay, not a problem. I'm not selfish. You understand? So I said, what's up? And he was like, yeah, I'm here. But he wanted to know if I'm single. So I said, no, I'm not single. So I said, that's it. So he said, thinks I'm single. I said, oh. I said, no, not at all. I'm off the market for a long time now. Long time I'm off the market. You understand? So we were there and I said, so what's happening? You're looking a wife or somebody? He says, yes. So I said, oh, okay, cool. So we were asking him what is it that he's looking for in a woman. And he said he want one that is a nurse and he want one that is over the water, overseas. So I said, oh. I said, okay. I said, well, good luck on that one, you understand? Good luck on that one. But I tell him that, it's always nice to find somebody as well in your area. You can always look in your community. Even though when I was growing up, my grandparents would say, I guess because at that time you're thinking about teenage pregnancy and all of those things. Not saying that they're bad pitney or anything, but I guess, they wanted to finish high school, go to college, things like that. So they would say, don't pick up anybody in the community because it would be too much of an easy access to each other. So I guess some persons can look at it to say, oh, they're not going to date anybody in them community. But even if it's not your immediate community, you still can find, a really good candidate in around your community itself, like in a different parish or something like that. So that was it. So he said he wants a nurse and he wants somebody that is overseas, the whole 9 yards, and him can sing and him can preach and him can run and him can cook and him a security guard and him, all the nice things that you're looking for in a Jamaican man. Anyways, let me not mixing up here, man. I'm gonna go. All right, I'm gonna go. Enjoy your evening. Stacey D, you're still here. Brooklyn, welcome. Call to All Arts. Enjoy your evening. All right, enjoy your evening, Chanel. And I will see you. Remember to go ahead and follow me, people. Go ahead and follow. All right. It's a nice vibe over here. All right. It's all about nursing, travel, and lifestyle, and a little bit more. All right. So go ahead and follow my page, and I'll follow you as well. All right. Enjoy your evening, Stacey, as well. All right. Bye.